welcome back. My name is Christian. Next to me, we have a host, Alex. Then
What's
we
up,
have
what's up?
Brian.
And we got our special guest, Dr. Jose Roque. That's how you say it, right?
Yeah, thank you. Thank you very much for having me tonight on the Connect.
Yo, thank you for stopping by, man. We
Absolutely.
appreciate
We're going to have some fun tonight.
For real, bro, I actually appreciate you for being here because I got a lot of dental questions.
Yeah?
No, for real, because
Well,
teeth are important.
myths. Well, like I don't think it's myths, but like what? Well, go no.
Well, let's
ask
start
him
from the
later.
beginning. Let's find out a little bit more about you.
Where you
All right.
from?
Yeah, where you from? What school you went to? How'd you even get into the trade?
Sure,
You know?
sure. So I was actually born in the suburbs of Chicago in Glendale Heights, Illinois. But in 1992, I was 5 years old. My family and I, my dad's company relocated, and all the families relocated to Sarasota, Florida. So it was just a means of getting to Sarasota. And then I went to school. I went to Booker High School, Booker Tornadoes. And then I went to
Go Tornadoes.
Go Tornadoes. Go Tornadoes.
Is that school still around?
It is, man.
I'm just kidding, I'm just kidding.
It is.
Oh, dead.
And I went to Manatee Community College when it was Manatee Community College. It's State College of Florida now. So another little local rep. But then I got away for dental school. I'm sorry, before dental school, you have to have 4 years of undergraduate degree. So I did partly a lot of my undergrad degree stuff at Manatee Community College. Then I transferred to the University of Florida, and I completed my junior and senior years. And I graduated with honors from the University of Florida with a degree in food science.
So why did you become, like, what made you want to become a dentist?
So that's the thing. You might be thinking like, whoa, you had a food science degree, and like, how did you become a dentist?
Wait. So you didn't, like, when you were in college and you got your degree, you didn't actually go for dentistry or anything like that? Dentistry is a trade?
Well, hear me out. Before even that came to fruition, back in high school, I originally went in with the intentions at Booker High School in the Law Academy. I was gonna be, I was gonna be a lawyer. I was, it was like a academy that was set up to prepare you for.
That's what you wanted to do. Like, you didn't go to school for law.
Yeah, I went ninth grade in high school, and then I remember we did this mock trial. It was like when you do like a simulation trial, and we were the defendants.
Yeah.
And man, the defendant got like guilty on all charges. Like, we didn't defend a lick. So it was like, I was sitting there like, dang, man, our defendant just got guilty. Like, we didn't like do our job. And then that was a crossroads. And then in 10th grade, my career counselor came in and gave us a questionnaire, and it generated your 3 top career choices.
Yeah.
And my number 1 choice was dentistry.
Really?
Yeah, and from there,
Looking back at it, do you regret, like, like, would you want to be something else, or are you content and happy with being a?
Well, let's just kick it back to that moment in my time, because I was like in a crossroads. It was either going to be lawyer or dentist.
Right.
And so what I ended up doing was I got some advice from a teacher, and she said that her son got into medical school, and he was shadowing somebody in town.
Yeah.
So I started doing that too. I shadowed a lot of dentists in town that I still am 20 years later still in connections with.
Yeah.
They're now like becoming deeper rooted relationships. And that's just kind of one of the things about being local, man. You know, I've been blessed to be able to come back to my hometown and be doing what I love.
Yeah, no, that makes sense. There's like some like stuff that I wanted to personally know to ask you as a doctor, a real doctor, CPR type shit. Veneers.
Yeah.
Brian.
Like, what do you recommend? Composite veneers? Because composite just goes on top of the tooth, right?
It can. Yes.
But because I've seen people get like the veneers where they shave down the teeth and they look like rats.
Yeah, they look like little baby teeth.
Okay, so those are probably more traditional crowns.
Okay.
If somebody is preparing teeth for veneers that are that bunny rabbit looking small, then they're probably not doing it right.
Like the Steve Harvey look.
Like the Steve Harvey look, but
where it looks like
Is
it's
that
not.
veneers?
no.
Steve Harvey has veneers, doesn't
He
he?
probably has crowns.
Really?
I mean, yeah, he just has, a chiclet smile,
Yeah.
He's got something.
That's a little weird.
But the
bro.
big difference between a crown and a veneer is that the veneer just goes over the front side of your tooth.
Okay.
It's bonded, and it can either, like you said, Brian, it can either be done like same day with a bonding material, like a tooth-colored material, or we can take a little more steps and communicate with the laboratory so that we can design a whole smile made of porcelain veneers.
That takes more time though.
And
Takes more time. It's a little more like, 2 visits or maybe
what's
more.
the price range?
I mean, a composite veneer is a lot cheaper, obviously, because there's not a lab bill, and you can make it directly same day. So,
Yeah.
I mean, it's probably a couple $100 for a composite veneer, but it might be even the more higher 8, 9 to 1,000, if not a little more for the porcelain veneer.
That's crazy.
Really?
Yeah.
They're doing 5,000 in Miami, and they get the whole mouth done.
They do. I mean, I could.
Some veneers look good. Some look fake, bro. Some are just like.
All veneers look fake.
Everybody-
No, but I'm
You
saying
know
like
they're
some
fake.
look good
You
though.
know they're fake.
Like,
Although I do veneers, that is not my primary source of what I'm doing in my practice.
yeah.
I do offer that. I've done cases, cosmetic cases. There's a demand for it. You have a patient who might feel lack of self-esteem or maybe feel some type of way about their smile. So if you can do something for them that day, I mean, you've won a patient for life.
For me, bro. Me.
That's
no,
right,
No, I
you.
swear. So like, I was so insecure, bro, because
Can you zoom into that too?
What? No, you.
Nah.
I fucking did. I had a chip in my tooth, and this shit was like, I don't know if you guys ever saw it, but
We didn't.
I had a chip in my
You
tooth.
probably hit it.
It was.
Why you didn't smile so big? Because
I was
you'd be-
like I would always like smile like kind of like up, because if I look down like that, you would be able to see it. Like it literally, bro. I was missing piece of my tooth.
Why do you miss it?
Yeah,
what
what
happened?
I literally just bit into a fucking sandwich and it broke off.
That's
Those
what
are
they
the
always
worst.
say.
No.
worst.
But like, bro, no,
Yeah.
I didn't. I wasn't like. I wasn't like. 'cause,
Sure.
Bro, I see people really fuck up their teeth from the
For
bottle
opening the
opening
bottles?
shit. Yeah, bro.
Yeah. Well,
Like, or like they always chew on ice and shit.
but we were able to help you.
About
Oh.
that,
Is chewing ice bad?
because I have a big problem with that. So
I did too. I stopped. I don't know why, but
So the ice from that Chick-fil-A ice.
that's the good ice. That's that shit that we.
Yeah. Oh,
Y'all-
the crunchy ice.
That's
It's like different
ball.
ice,
Yeah,
you know?
That's that crunchy ice.
I got patients that say they be on that like on the reg, that Chick-fil-A
Bro, that
ice.
shit, that ice cap, that. for
But
real, no cap.
you know what? If I think I've posted some stuff on my social media.
I seen that.
Just imagine the best way I can describe to my patients is that the tabletop of your back molars is like a mountain range, and the cusps or the sharp parts are like the mountain peaks.
Yeah.
And then as you kind of get down deeper in the grooves, you get kind of the valley of the mountain range. Sometimes if you chew ice or if you get a popcorn kernel or just any nut or something at the right angle, your mouth and your jaw muscles are producing pounds of force that could easily shear off or break off a piece of your tooth.
Me, bro.
In some instances, the tooth is still savable, but you may need different procedures, like if the patient's in pain, root canals
Yeah.
and different means of then putting a crown on the tooth. But long story is that could sometimes deem the tooth unsavable because maybe it cracks in the root and now the whole tooth has to come out. And now you're looking at more tooth replacement options like either an implant
Yeah.
or a bridge. Which I don't know if the whole point of the thing was for me to talk about those options,
no,
but I mean, it's just I could get into it, but bad things can happen from chewing ice. So if I could say anything to you guys, don't chew ice.
Don't you ice?
And another one that we had, he was wondering, wisdom teeth. Does everybody have wisdom teeth?
I have
Do
one.
You have to get rid of wisdom
Yeah,
teeth?
yeah.
I think I don't have any wisdom teeth.
So
don't
I
know.
personally haven't experienced that. Like I hear people like, oh my god, I need to
Like
go
my
and take
tooth
them out.
aches.
Yeah.
Like
But like me personally, I've never done it, so I don't know.
Yeah.
Is it an age thing?
So I'll say a few things about wisdom teeth. Usually around ages 18 to 24 is when wisdom teeth are making some type of movement in your mouth.
Yeah,
You're still
mine.
kind of young, but you're growing. So usually if you're 18 to 24, that's usually when they're making their, movements or they're maybe causing, they're making their grand entrance.
Yeah.
Sometimes these movements cause a lot of pain or infection. If maybe if there's a good gum covering over your wisdom tooth, maybe it's partially out.
I'm like checking mine right now.
Food and things can get underneath there,
Yeah.
and then the gum swells, and then it causes a lot of pain and localized infection. It's not
so
fun.
That's why. Okay.
You got to get in there,
That's
I got to
crazy.
flush it out. But the type of wisdom teeth that you want to look out for, and maybe you're not aware of because you need an X-ray. The dentists might do something called a panoramic. That's what shows your 4 wisdom teeth over like a little X-ray of your whole teeth. If they are tipped inward and they're coming in,
Oh, they're coming
this
in
way.
like this.
Well, those are horizontal. I'm talking more of a 45 degree coming in this way,
Oh.
Hold your tongue.
coming towards the other tooth.
So it
Hold your
causes
hand up,
okay.
Hold your hand up. It's like this.
So and it causes you like your teeth to like start moving
Well, they
forward.
could move forward, but what happens here is there becomes a food trap right here.
Oh.
And you
Bacteria all
can't
that,
clean
okay.
it and everything. And then I've had patients where not only do they lose the wisdom tooth, but they have to lose the cavity got so bad on the one next door, they got to lose both teeth, both molars.
What's okay? This might be a stupid.
So wisdom
question.
teeth
What's
are-
what the fuck is a cavity? Like what it like?
A cavity
Like how does like
is
yeah.
the most common disease in the world.
so cavity is a disease.
It's a disease. Essentially, when you are eating certain refined sugars, like
Is it just
chips
from
and
people not
stuff.
brushing their teeth?
Well,
or
it's
what
a
the-
combination of time, bacteria, lack of oral hygiene. Like if you're not brushing and doing your part, the bacteria is going to be able to form
how often
a
like,
stronger
should you brush your
attack
teeth?
on your teeth.
How often should you brush your teeth? Like,
Well, I mean, ideally twice a day. There's patients that do after every meal. I think that's excessive. It should be quality
how often do you brush
over
your teeth?
quantity.
After each meal.
Really? You brush?
Yeah. I
Damn.
used to like in high school. I would do it in the morning. I would do it during lunch. Not no more.
Make
Because
Is
sure
that
it's a
what-
soft bristle toothbrush.
Is that why you have such a bright white teeth?
He got good looking smile.
Oh, we were
he said
talking
he
about
wanted
that.
veneers. I was
I
like,
want-
Bro, there's
veneers,
there's
bro?
times
Like,
where
he's
Brian
tripping.
has like his teeth are so white they're like blue.
yeah, there was a time when I was
Like no shit.
I can't.
Is
Get,
that-
oh, well, do you believe in charcoal? Like, is that how people like put charcoal in your
Oh,
mouth?
you used to
and-
do that?
No, but
I was going to. Well, I'm
Bruh,
that guy.
don't do that.
I'm the guy that had the
My girl
teeth
said it was
whiteners.
right,
Well, I still am. I have the teeth whiteners, the 3D white.
You got
3D
the
white
little light
toothpaste,
thing
the
you put in, and
mouthwash.
you walk around your house.
Let's
Yeah.
talk about that. Let's,
Your boxers,
Let-
white teeth.
let's talk about that. Let's talk about that.
does that work?
Does it work?
Charcoal toothpaste?
Yeah,
Yeah.
bro.
Or, is
Okay.
that
Or-
just like an
or
ups-
whitening.
No, but no.
Let's start with charcoal.
The whitening does
Charcoal.
work, but
No,
I'm
I
I
saying
don't know
Talk
about
about charcoal.
charcoal. I guess maybe what was in it, I've never used it, but maybe it was a little more abrasive because charcoal's a little more rough.
Oh,
Yeah.
So,
So maybe it was like getting in there and roughening the stain away, but it could also over time cause
Enamel
more
damage?
harm than good.
Yeah.
Enamel damage.
Okay.
Enamel can't grow back. Once you lose it, you lose it. That's why we had to bond his
I-
tooth. He couldn't just grow his piece back.
That's what it is. That's
I had
what
to
it was.
bond his enamel back.
And I think I fucked up my enamel because of the teeth whitening shit.
Yeah, no, I
'Cause
don't,
I-
have,
yeah.
I don't have teeth.
all right.
in
What
anymore.
about
You don't? What do you mean you don't have
Bro,
teeth
my
enamel?
teeth
So I'm gonna
are
give a couple
shiny.
shout outs for some whitening. I don't have any they don't pay me to do this or whatever. But I tell my patients if you're just trying to get some whitening, you can get from Amazon or from over the counter. You can look up smileactives.com. Look that up. That's a toothpaste.
Okay.
And then there's the actual whitening strips on Amazon. You can try Zimba, not Zumba, but Zimba.
So what's the difference between Zimba and the ones that you just get from Walmart? Is it more
I
na-
think that these Zimba ones are more like natural and they don't cause sensitivity to your teeth.
when I use the teeth whiteners, like literally like anything cold, bro, it's so
It
sore,
hurts.
like
It
bad,
hurts.
bro.
You should follow up if you're whitening with some type of fluoride. So if you also buy Act fluoride rinse, you can get that at Walmart or over the counter.
Okay.
If you're doing fluoride after whitening, it's essential because you could get a lot of sensitivity afterward.
Gotcha. Okay, see, I didn't know that.
Yeah.
okay? What about those? What are those called? Water picks? Like the.
Yeah, I mean,
what, Do
yeah.
you recommend those? Like that machine that like you basically.
Yeah, I mean,
Water pick.
my thing to my patients is get whatever works for you. If traditional floss works for you, if a water pick works for you, if those little pickers.
You gotta floss every day though, right or no?
The best way, I sometimes go to the local elementary schools and I do like a little dental day for them.
Yeah.
One of the best ways that I get these kids going is that I say, if you don't floss, it's like going to the bathroom and you don't wipe. You're gonna go to the bathroom and then just just walk out.
Damn.
Nah, bro, like there's
Hey,
some stuff in
that's-
there.
That's wild.
My girl never
And that's where cavities form. If you don't floss, the cavity forms between teeth.
Between teeth.
That's
gotcha.
why you got to take care of that. Also, gum disease, which 1 in 2 Americans is walking around with gum disease,
What's how do you, like,
periodontal disease.
How do you know? How do you know?
Yeah.
Like
Have
what's?
it?
what are some signs?
I hope not.
There's 4 of us.
I think
here.
I got it, bro. Is that bad?
2 of us got it.
Every time okay, so what happened?
You probably got it. Once you said last time you had a cleaning.
What?
Damn, I probably have it then. At
About
that
to
point.
expose him, bro.
I just had my cleaning. When was it? When was
He's
it?
not. He don't got it.
6 months ago.
You
I
probably
don't?
both
No,
got
you
it.
know what?
Wait, wait. So then, if I don't have it, why do I? When I brush my teeth?
They bleed.
Yeah.
Because you Mexican and you got a lot of gum.
Shut the fuck.
No, for real, no cap. You got a lot of
I
like
feel
gum
offended,
around
bro.
your teeth, so
Is
it's
it
like
the menudo?
it's harder to like keep them
Menudo?
clean or
Is it
something.
the tortillas?
tortillas?
No, we just got a lot of gum, man. I don't know.
What do you mean?
Are you
What do you mean a
Mexican?
lot of gum? But why does it bleed though? Like, what's the scientific reason why it bleeds? What do you mean? Why a lot?
Okay,
Why does a lot?
you're
of
right.
gum?
There- You're honing in. The reason it bleeds is because bacteria builds up.
So you're bleeding because your mouth dirty.
Yes, and
Ah
No,
shit.
yeah, bro. Like,
For the streets.
mine used to bleed,
I'll
but
do
not
it.
anymore.
That mouth for the streets, boy.
imagine you working out. Here, real talk. Imagine working out
Yeah.
only every other month. You'd be sore.
Yeah.
Every time.
What if you worked out every time? You wouldn't be sore.
Yeah.
So if you floss all the time, your gums won't be sore and bleeding.
Okay.
That's the key then.
And also, it's important to remember that only floss the teeth you want to keep.
What do you mean? Oh, I see what you're saying. My dumb ass.
Oh, so you want to keep all of them?
What keep I'm so stupid, bro.
Y'all was slow with that one, bro.
My dumb ass, yo.
Yeah, what you mean?
I was dead ass.
What you mean?
No, my dumb ass was like, what teeth don't I want?
I never need them.
I was like, I want all my teeth.
my dumb ass was like, okay, so I just flossed the front ones. Got it.
Hey, and real talk. Some of my patients are religious flossers.
What do you mean?
I want to be like that.
Yeah, like they only
Yeah,
floss
I
on
need to- I need
they
to
only
floss.
they only floss on Christmas and Easter.
Oh, never mind. I thought you meant religious, like back to back. Like
No.
like,
They only floss twice a year.
Oh,
Yeah.
No,
Yeah.
I don't want to be like that. I don't want to be like that.
There was also a meme one time on Instagram where it was like a dentist and a patient.
Yeah.
And the dentist was asking him, when's the last time he flossed? The patient. And the patient said, you remember you were there.
Whoa.
Okay.
Yeah. That's,
So enough of flossing, man. That's,
so talk
No,
about that.
but periodontal disease or?
I'm talking about that real quick.
Yeah.
How often should you recommend anybody to go out and like get a dental check or get a
Okay.
cleaning
Every
or
6
what?
So
months.
in some circumstances, if your gums are healthy, every 6 months would be sufficient.
Okay, so every 6 months.
If they have gum disease, you have to get a deep cleaning. Okay. Sometimes they got to do it in quarters of your mouth. Perfectly normal. Sometimes they do half your mouth. They'll numb half your mouth. You come in one visit, they'll clean all those teeth. And then the next visit, the other half. But regardless of whatever your doctor and the hygienist do, that should be done. Then the cleaning every 3 to 4 months on a periodontal maintenance mode, meaning you're maintaining. It's like you getting your oil changed.
Yeah.
You get it every 3 or 4 months. But if you have healthy gums, you go every 6 months.
And how expensive is it?
I mean-
because out here, like, there's gonna be a lot of people who do have insurance, but there's also gonna be people who, like, for example, like most of
I don't got it.
like
health
self-employed people like don't.
So where I'm at,
Do you have
let me give a little
insurance?
shout out. Let me give a
Do you
little
have
shout out where I'm
insurance?
at.
health
I don't have health insurance. Do you have health insurance? Do you have it? All right.
Oh, because they're white.
Wow. I'm dead.
Racist.
So let me give a little shout out where I'm at. I'm at Greenberg Dental. I'm at 2 locations. On my primary practice is on Bee Ridge and McIntosh.
Mm-hmm.
Okay.
Okay, we can give out, on the links or something, maybe
Yeah,
the
we'll-
plugs, like
everything's
the
gonna
different.
And
The different where I'm at, my Instagram and all that stuff. But
Correct.
the other practice I'm at that near that Crunch on University in Lockwood Ridge, right next door. There's a Greenberg Dental.
Oh, I know that's it.
Yeah, so I'm at both those practices. But if you come see me, if your mouth is healthy, it's $59 for an exam and cleaning.
which is not bad, bro. It's almost
That's
60
cheap,
bucks, bro.
bro.
I've been trying to get you for a hot minute, but you's on that Snapchat
Yo.
ghost.
Bro,
Yo,
it's
give
like, bro,
me-
it's like getting 2 haircuts. Like,
I get it. I'm a little far away from here,
but if you think
on
about it,
Bee
bro, like, you
Ridge,
do maintenance
but
and everybody cuts their hair every week.
Yeah, no,
University of
You know
Lockwood
what I'm
Ridge is
saying?
straight too,
$60, bro.
Give me in next available. Give me in if you.
Well, yeah, let's talk to my secretaries and
All
make it
right.
happen, okay?
Bet.
My secretaries, right?
Yeah,
Him
you
up on
already
the
know
We got
secretaries.
the S on the end, bro.
Yes, S.
Ooh.
Okay.
Secretaries.
I appreciate that.
Stop playing,
But
bro.
thank you though, because I think it's been honestly almost a year since I had a.
Well, here, tell them about your experience with your cleaning.
No, dead ass,
Alex.
bro. Like when I
We don't
went,
care.
when I'm dead.
I'm just
no,
kidding,
I
I'm
won't
just
say
kidding.
shit.
Tell them
bro.
about the before and after experience.
No, it was, bro. I had a really nice experience, and to be honest with you, the confidence that I had, like whenever I walked out there, like they were literally cleaning like my gums, like with the, what do they use, like sandpaper type shit?
No, it's like a little Cavitron, like a little water pick thing that shoots in there.
Yep, I don't know,
That
bro.
water pick.
Literally, I walked in with my breath smelling like straight cheeks. I walked out, bro. I was Mr. Clean. For what I did, like no, like
I
the
seen
top,
it, bro.
like
I
the
seen
caps,
it.
like back here, was all like filled with like just like built up.
Yeah.
and it was
Was
it
that
turned the
from him
same
not
color.
brushing his teeth, right?
So real quick, let me just give you a little 2-second educational thing about that. So originally, if you don't brush your teeth that well, well, let's just go like if you eat a Snickers, your gums are gonna feel a little slick and slimy.
Yeah.
That's plaque. Over time, saliva mixes with plaque and causes tartar.
Yeah,
Tartar was the buildup that they knocked off. But that happens even with the really good flossers. If you hadn't had a cleaning in a while, that stuff's like not fossils, but it's like
it's hard. I thought it was
calcium.
my
It's like
teeth.
a mineral. So like when it gets like off the teeth, it comes out like a chunk.
Yeah, I thought it was part of my teeth, and it's literally the same. Isn't it like the same? Becomes the same color as your teeth, doesn't it? So I literally, when I was done, it literally felt like she took pieces off my tooth. Like I can't explain.
But it felt good though. You were
I
like
did.
reaching down there with your tongue. You're like,
Yeah.
yeah, that feels
Sensitive,
different.
though, right? After
Like
the
2
fact-
chains.
after the
No,
cleaning, it was
mine
sensitive
wasn't sensitive.
in a way or no?
No.
'Cause
Sometimes.
This isn't school, you
So
can-
hear me out. If there's when
This
you
isn't
uncover
school,
that, if there's like some of the root is exposed because the gums got pushed back because the tartar built up there, they might get sensitive. So sometimes that might turn patients off from getting deep cleaning. Oh, I'm gonna be so sensitive afterward.
Yeah.
Yeah, but I think in the overall long term, it's better for your health because the studies have shown that periodontal disease is happening in 1 to 2 Americans. And the links that
Is
it
that
has
gum
with the
disease?
health,
That's wild.
the links that it has with health, you can have hypertension, you can have stroke, you can get diabetes.
From your teeth?
If you're like a mother who has a pregnant, you can have low birth weight and early birth terms or whatever you'd say.
All
Like
this
have
shit
them
from your
early
teeth.
and so they're premature.
Yeah.
All this associated with the inflammation that's going around in your gums. Because the best way I can describe it is like barnacles under a ship.
Yeah, yeah.
You know how that builds up underneath
yeah,
the
yeah,
water?
yeah, yeah.
That's like underneath your gums. You got to get in there and you got to have a professional,
What do you mean algae?
Like it builds up on top of like the rock.
Oh, yeah.
you know, so it's a process, but I'm happy you had a great experience and how it changed your confidence.
No, I did, bro. I literally I had like I said, I had the chip in my tooth. I didn't want to smile. Like every time I would always like cover my mouth. And then after, like you took a picture of me too, and it felt good, bro. Like I just saw my smile, and I just felt like I could smile again. It was crazy. I don't know. That's the first.
It's an everyday. That's an everyday thing.
Because
bro.
I know I was
I'm
just people
blessed.
off their teeth.
You blessed. You blessing people out here.
I'm blessing people.
I was just people
How
off
does-
their
Blessing
teeth.
to be a
so
blessing.
I felt good.
Ooh. Oh, yo, say that again. Say that again.
I said it's a blessing to be a blessing.
That's hot. Yo, that's hot.
Yo, I had a question. So I heard when they find like dead mummies and stuff, they look at their teeth because like you know how you said your teeth is like you could tell everything by their teeth.
Get out of here.
What do you
I've heard
mean?
of that.
What do you mean?
Have
everything
you
on
heard
your
of
teeth?
forensics?
Yes.
Yeah, they go
Dentists?
off the teeth.
Yes.
So let's say somebody burned to death. Everything in their body turns into like carbon ash,
Yeah.
but their teeth remain.
Oh, for real?
I think, yeah. So anyway, like let's say they find a murder scene and they need to identify a body.
They could do it by their
They
tooth.
can do it by their teeth.
How the fuck?
Because they'll look at like the patient's teeth, or not the patient's teeth, the victim's teeth.
Yeah, the guy's dead.
And then be able to then correspond who was their dentist, and maybe they'll like consult their dentist.
Oh,
Say,
that's
do you have any
wild.
old records? I don't know how they do that with like HIPAA privacy patient,
Yeah.
but I think when it's in a crime, you know, I think maybe they, you know, the
Yeah,
detectives
and-
can get that,
and then they
and then
can-
they can do a with certainty. Because how bad is it that you'd hear on the news, victim is so and so, and then they have to then change the identity of the person.
because of
Imagine the name of the first family that found that out. And then they have to tell the second family, oh, we misidentified the body. So that's a very important,
I'm
critical
dead.
part of forensics dentistry. Yes. So yeah, the mummies and all that thing survives because it's like just lasts forever. You know, it's enamel.
you were talking about something about like your teeth are not supposed to be white. Is that what do you mean?
Okay,
What did you
so
mean by
teeth
that?
are not supposed to be white. They're supposed to be like a bone marrow color, no?
I don't know.
No.
The heck? What kind of question is that, bro?
I fucking
A
love
bone
it,
marrow
bro.
color? What is it? Bone marrow color, bro?
Shit.
Like his color.
I said the same goddamn thing. What the
Nah,
fuck
no.
color is
That's
bone
what-
marrow?
if you-
See, they're supposed to be white. You know, they're supposed to be only as white as the sclera
So
of your
wait.
eye.
I'm asking you.
Your
I'm-
eye.
So it's
That's
like a
bone white.
So if you went and did some like
What's
white,
that? I don't know.
Yes.
People want the white.
Yeah,
want
they
white.
want those
They want
those like
like
porcelain, you know, like
white.
tile, you
White,
know,
right.
like
white.
chiclet white.
Yeah, that's like only off of veneers.
I want.
Yeah,
shit,
that's that.
People want this shit
Who's
white,
it?
bro.
Bad
Celebrity
Bunny's got a
smile,
smile like
like
that or
the-
something.
Yeah.
I want mine to be gold. I ain't gonna lie.
Gold. Oh, let's
Everything gold.
like the people who get grills,
Yeah.
like
You know who you are.
what? Wait,
Bro, that shit is the ugliest thing I've ever
so
seen.
fucking
Like
confused.
grills, diamond grills, like bro.
Is that okay? Like, does it hurt
Like,
your
wh-
teeth in the long
Grills, a
run?
lot of them are superimposed over your teeth.
What do you mean?
Meaning
Cement
that's why
them,
when that's why when they be like smiling, they look so big.
Yeah.
Because it's doesn't involve your tooth being prepared. They don't have to shave your tooth down.
Yeah.
They just put like something over you, and it could be gold or got diamonds in it.
Yeah.
And when you wear it, it's like grill, you know.
Yeah.
No, but I've seen people where they actually do get their teeth shaved down, but when they take off the grill, it's like nasty and dirty and dark.
Well,
and,
it's probably
It's
because
because you said
the
like-
seal. There's like
yeah,
a
the
seal
seal.
breakdown that the saliva and food started seeping in, and they couldn't clean it right, and then cavities. That's how
and
cavities
their
form.
breath stinks, right?
And their breast stinks.
I
It's
heard,
not cute.
I heard Lil Wayne like has his grill whatever are his actual teeth.
Is that
He might have like
Oh,
you know
you
some.
could.
I should look that up, but he might have some
Like
extensive like expensive
Veneers
grill situation thing,
in?
permanent thing.
drilled in. That's what they
It
do. They
might
drill
be.
that
That's
shit.
what they do, right? They could drill teeth in.
Well, I can make a crown with different materials. I can make a gold crown, or I can make a like an all porcelain crown.
Oh, like
Those are the more
with Veneers,
aesthetics, crowns. So a crown can be made out of anything. It's almost like jewelry.
Yeah.
Jewelry and dentistry, like it's like a lot of like the same way you make jewelry is how you make the crowns and stuff like that. So it's kind of different. I think it's a fun fact to note that the only more precise job on this earth is watchmaking.
What do you mean?
Like watchmakers have a less of an air scale than dentists do.
Oh, okay.
Does that make sense?
No, I don't know. I'm confused.
The precision of their work is more
Oh, okay.
fine-tuned
I see
than
what you're
where
saying.
we're at.
Yeah, I see
But
what
it's
you're saying.
still like a low air scale for us. But I think imagine making a watch
Yeah.
and putting all the pieces together and
That's
then
what
having
that's-
it
Okay, you're comparing a watch.
having
to-
it click,
that
you
makes
know?
sense.
That's probably a little bit. If something's slightly off, it
Yeah.
ain't gonna work. For me, if something's slightly off, it's
Have you
not
ever
gonna
feel
work.
like I don't know if you're allowed to say this. Have you ever fucked somebody up? Like, so for an example, like Brian, right? Whenever he cuts someone's hair, like it grows back. This shit grows back.
Barbers and dentists, right?
But yeah.
Oh, well, we'll talk about it.
But
next
no,
time.
that's a genuine question. Like,
You
how
know
do
what, man? Listen,
Like, how do you
it's
fuck
called-
someone
it's
up in
called,
dentistry?
It's called the practice of dentistry.
That's
for
what
a
I'm
reason.
saying. So like,
It's a practice.
what's like the worst way
I've
to
been
fuck someone
8.
up?
I've been 8 years. I've been 8
shit.
years in practice. To say I haven't made mistakes.
Maybe not you, but bro, they fucked my. They
Y'all gonna
fucked
start
my-
putting people on blast, bro.
No.
Dentistry is tough, man.
Bro,
I'm
the
not
other
saying no.
dentist was like-
I'm just,
the
bro.
dentist
I'm
was
not.
Like, who do you go to?
Hey, remember, one at a time. One at a time.
Yeah, go ahead.
He cut me off. Thank you.
No,
guys.
no,
But
sorry.
no, the dentist was like, "Yo, where you go to?" And I told him where I went, and then he's like, "Yeah, don't ever go back there again."
Yeah, like you can get
Because
your.
they put the filler and it didn't grip onto my tooth,
Yeah.
so there was a gap in there, and food and
Sure.
like disease was getting in there, and my breath was staying, boy.
Yeah, bro.
And then
Boy,
finally,
it's still staying,
I
bro.
had-
Where'd that go, man? Pass it.
Get your boy. Get your.
Got that doo-doo bread, boy. He actually handed him gum, bro. I'm fucking dead.
Honestly, I came prepared with gum because I knew we were gonna
Yeah.
have Roque, and I'm like, he can't be exposed. to
But
business.
but if
By
go
the
ahead.
way,
Go ahead.
a follow up, Roque.
Yeah.
That's not a common last name. What, like, a lot of people don't know, but what are you? What's your
Ethnicity.
ethnicity? What's
Ethnic
your
background. So I am first generation Mexican American.
Yo. Okay.
Yeah. So my
Anchor baby, actually.
Yep.
my parents actually came. My dad came as an immigrant when he was 18. And he just kind of had that American dream, you know, kind of that grind mode. And long story short, I was born and I was fortunate that I had two parents that sacrificed a lot.
Yeah.
You know, my dad has worked with the same company for 40 years. He's like a shipping clerk. And then my mom is she just actually went part-time, but she like does like for the most part of her life has been a housekeeper.
Oh wow.
So it's like those are jobs that, you know, it's not like, you know, people don't want to do those jobs, but they sacrificed everything they could, you know, so that they could give me an opportunity to be able to make it in this world and be able to make an impact and be able to, you know, have a pretty successful career, be able to make money and to help people and to help my future generations aspire to become something greater.
I mean, there's like some like I don't know what the word is, like some pride in like being a dentist, especially from your family coming from Mexico, and then or you're like one of those like jobs, right? Like you police officer,
Doctor.
fireman, doctor. You know what I mean? Like
Dr. Jose.
My real doctor?
Oh, that's a
No.
good question. Do you get that often?
I
Like,
mean,
well,
am I?
'Cause I feel like the only other people that say he's not a doctor is like nurses.
Correct,
and,
because
stuff
they're like-
that,
They're
because-
haters or
I've
something?
heard that. I've heard that.
haters.
but you're just a doctor because of like the,
I am
like
a
your
doctor.
school,
So
right? Because you're-
DDS, I'm a DDS. I'm a doctor of dental surgery.
Yeah. Okay.
But there's also DMD, Doctor of Medicinal Dentistry. It's the same degree from different schools.
Yeah.
But we're both doctors. Yeah,
Gotcha.
so But
Doctor is just basically you know your shit. Like,
doctors is I had to do 4 years
Yeah.
of undergrad, 4 years of dental,
yeah.
and then I did an optional 1 year residency after dental school. So I went to dental school in Omaha, Nebraska, after
Yeah.
the University of Florida, and then I did a 1 year residency at Wichita State University, Advanced Education in General Dentistry.
So how many
old are
years
you?
altogether? So like how many?
So
years
I was
did
in
you
school
say?
for 10 years.
10 years.
Yeah,
So you
after high
finished by-
school.
You finished by 28?
I guess.
Yeah.
Yeah.
28.
Yeah, I was like
wait,
that
how old are
age.
you now?
I'm gonna be 36 in October.
36.
Yo,
Not bad.
36.
Yeah, I'm getting up there, bro.
36, bro. You're dentist, bro. You're
Grinding.
Doctor.
So going a little bit kind of back on what you said. So 10 years. Now, explain to us, or I mean, if you want to kind of let us know about did you get into debt? Like, was it like
That's right.
Yeah.
was it like healthy debt? Like, like because there's debt that's like not
There's-
healthy.
That's good.
And
though,
then
'cause
there's-
you found-
Yeah,
Debt.
there's liabilities and
Find a job.
assets. I mean, I don't think this is
Could
an
you-
asset, but it was an investment
Yeah, could you touch on that?
in myself. But yeah, you're right. I mean, I got into hundreds and thousands of dollars of debt after.
Hundreds
Just to
and
be a
thousands.
Just to be
Is there an
a
exact
dentist?
number? 'Cause
That's
people out
6
there wanna know.
figures.
I think at my peak, I was at 428.
Oh my god.
Whoa, wait. You're $428,000 in debt for you to be a dentist.
Yeah. But I was slack though. When I got back in town, I didn't really pay my loans. I was like, and I let that interest multiply.
Bro, that's like
It was more like
500,000.
375 when I got out, but then I was like slack,
It was what?
and the interest rate blew up.
Can I ask you, is
375?
the risk to
So you got it for
reward?
428. Yeah, so I was slack.
Is the risk to reward? Do you think it was
Worth it?
looking back at at
Yeah.
it now? Obviously,
So there's a study too. I don't think it was a study, but it was something that I heard about
TikTok, Instagram.
a plumber and a medical doctor have the same net worth at 42.
yeah.
So meaning the plumber came out at 18, maybe did a trade school, got their money up. Maybe they got the experience and they were getting paid 80 to 100K.
Wow,
Maybe
yeah.
more. They got their business, but all this time the medical doctor is in residency fellowship. I didn't do all that stuff. I just was kind of like 10 years in school. But there's some medical doctors that graduate $500,000 and more of
bro.
debt. And so eventually there's that 42 age. The medical doctor then gets the net worth that's higher. But I mean, is it worth it to answer your question? I think if I saw a young kid right now in 18, maybe in high school, and he was trying to decide what he or she wanted to do, I'd have to just really look at him and say, I love what I do. I'm blessed, but you got to really make sure you're in it for the long run.
Yeah.
Are you looking at 10 years of your life while people are, partying and traveling and having fun and having families, willing to sacrifice 10 years?
Yeah.
Maybe you do it shorter if you're smarter, but it took me 10 years. And then,
you're saying
getting all this debt and it's a lot. It's a lot to sacrifice. But if you're in it for the long run, I mean, I have a career where I'm able to help people get out of pain and also feel better about their self-esteem. I'm able to do it every day.
That's crazy, bro. $428,000 in debt, bro, just to be a dentist. That's insane. Is the risk to reward worth it? Like, I'm not trying to. I'm not asking
I hear
exactly
you.
how
So
much you
right
make.
now with the freeze and the COVID and everything, there was some school loan freezing of the interest rates.
Yeah.
So I've been able to go Mamba on it a little bit right now. Yeah, I've been going hard on
that
it.
paint.
But then there's also a whole school of thought of should you put that money towards investments?
Yeah.
As
you
opposed
buy
to
a
paying
Lambo?
off debt, So it's tough. It's tough, but I think the debt's always going to be there. I think it's not
That's
going to
what I'm
go
saying,
anywhere.
bro.
So you might as well go Mamba on it or something.
That's what I'm saying. Like half $500,000. Like how many people even make that in their lifetime?
A lot of people. Minimum wage.
A lot of people. You think $5 or $400,000 in their lifetime? You think?
Yeah, bro. Minimum wage, you make $36,000 a year. 10 years, that's $360,000. Add another 5, that's 450.
But it's like when does the average person make $30,000 a year? Like,
McDonald's,
are people making that now at McDonald's?
15 minimum wage. Walmart, 20.
Wow.
20?
Yeah.
Damn, they getting racks.
Bro,
Most of
what
my,
are you
I have a lot of
doing?
clients who like 17 to 20 years.
Making $30,000 a year?
Jeez, bro.
$30,000 a year is not that much.
No, I'm not saying it's. I didn't know that's what they were making now.
30,000
That's
divided by
wild, though.
12.
That's walling out, like Nick
but,
Cannon.
But I'm kind of proud of you, bro. Like it's crazy that you managed to kind of come back into just being more productive and stuff like that.
Then just a fun fact: I got 140 cousins and counting.
Whoa, wait.
What?
Yeah,
What?
I do.
What?
Got 140 cousins and counting.
Do you really?
Whoa.
Yeah,
Wait,
and I was the first doctor in the family.
I got
Oh,
like
dude,
I got
congrats.
like 150.
So that's kind of live.
Okay, for a second, I'm like,
kinda
why did my
live.
boy just say a random fact about his? About
I was tying it in. I'm sorry, but
yeah.
Think about the
No, but I
orgullo
didn't
and
know
the
what he
pride and
was-
stuff.
I didn't know where he was going with it.
But-
I didn't know where he was
The
going
Roque,
with it.
Dr.
It's
Roque.
like,
You know what I'm
it's
saying?
just like saying, hey, by the way, I got 328 million hair fibers on my head. It's like,
No, but
okay.
but bringing it back, dude. What do your parents tell you? When they see that you you got the doctor, you got the robe, because a lot of, especially immigrant parents, they come and they want you to be a doctor, they want you to be a lawyer.
Like you actually
And
became that.
You became that. What they say.
So I mean, obviously, they're probably really proud.
Have they told you that?
maybe, you know, not as much because I was like, you know, living away a long time. But you could tell in the patients, I treat a lot of maybe their friends and family and stuff too, or their friends, I should say. And I'm sure, you know, they go and tell my dad or something. I'm sure that's like the way my dad like gets his not enjoyment, but his thrill out of like, you know, hearing that his son's a doctor when he knows that he's treating the, you know, their friends, you know, good and treating them good as patients. So they're probably happy of that, you know.
Yeah. Even probably your dad, even if he hasn't even told you, he's like the risk of him kind of coming and the reward.
Oh yeah, that shit paid off.
No, definitely. Like I think my dad, it comes from a generation where like you just had to work hard.
Yeah.
And like you just had to keep your nose down and you had to keep moving forward. So I think, you know, they come from like you can't show emotion, you got to be you can't cry, or you got to be a strong man. But I think deep down inside, his way of saying he's proud has been with provision, you know, in my life. I never lacked anything in school. We never lacked food or roof or clothes.
Yeah.
From both of my parents' sacrifices, you know, and so we were able to live a very, very fortunate life in Sarasota, Florida, where it's paradise.
Can I ask you something? It might be, I don't know, it might be a personal question. You don't have to answer, but I'm just curious. Like, at what age did you move out, like, with your parents? Like, were you still living with your parents while you were going to school, like, for obviously those 10 years?
Yeah, well, I went to MCC for 3 years. So after high school, I was there for 3 years. So around 21, 22.
Yeah.
I'm sorry. Before that, I was at UF. So around 21, 22, I was graduating UF.
Okay.
And then I went to UF. I was in Gainesville, so I was away from the home for 2 years.
Okay, gotcha.
But then 4 or 5 years in the Midwest for dental school and residency. So I was gone for 7 years from home.
So were you were like working whatever, like a part-time job to provide for your housing for school?
A lot of this stuff was loans.
Just loans.
Yeah, because you were like a full-time student. Like they were going Mamba in dental school.
Damn.
Like 8 tests and like 10 practicals or something. Something crazy.
Who showed you about finances, or who basically put you on game, or like, because I mean, think about it, like somebody coming out of high school, not like not a lot of people know, oh my god, I gotta get this loan, or oh, I gotta like be smart about paying this loan. Like how did you manage to get knowledge on that?
So my thing, not to say anything bad about my parents for this, because again, I just shared with you all the good things they did for me.
Yeah.
But I couldn't go to them and say, hey, mom, dad, I have this problem. Or I need a mentor in this department. So when I started shadowing dentists and people, I started really meeting older people that were my mentors. And they were the ones that, you know, the funny story, I had a fork in the road where I got to go to dental school. Yeah. I either could have stayed in Fort Lauderdale, Florida, or I could have went to where I went to in Omaha, Nebraska. Think about a 22-year-old who maybe was like, you know, dang, it'd be nice to stay in Fort Lauderdale, close to Miami. Yeah. Friends and family, the beach. Mm-hmm. But I decided, well, with the help of my mentors, they helped me look past all that, and that led me off to packing my car with my TV and some clothes, driving to Omaha, 24 hours, and then I was there for 4 years.
So you just got your shit in your car and you just left? Just
left, man. My buddy, Dr. Sean Coyle, he drove with me up, and then he flew back from Omaha down back home, you know. So yeah. But he drove up with me, and that was fun. It was a good memory.
Damn.
Quick question. Out of like all those years, I'm sure you had like colleagues or friends that were in it. How many of them like didn't make it to 10 years? Because 10 years is a commitment. Or like not necessarily maybe they had to be 10 years, but like
classes are like 30, right? Or how many
classes?
How many students are in
No,
the
like
class?
That's what I'm saying.
There was probably 85 in my class, 100.
Yeah, like how many like continued? Like what would you say the ratio is?
What do you mean who continued?
Like
how would you know that?
A class of barber, it's like 12 people, and that I remember now there's only 4 people cutting hair.
Yeah, that's what I meant.
I see what you're saying.
That's what I meant. Like,
dude, everybody, man, if you got yourself $500,000 a day, you better be going doing some dentistry, bro. Like there ain't no like I'm gonna post up.
Yeah. So it's normally like 100% like completion. Then is that what it is?
Oh, who didn't make it?
That's what I'm saying. Like
two people out of 85.
Oh, okay.
Oh, damn.
Yeah, no. I mean, and Creighton gave you every opportunity to remediate, and we're gonna give you 19 chances, you know. Yeah. And so if after 20 chances you can't,
oh wow,
maybe it's not meant to be.
I have another. Okay, so it's more like personal, but it's like, okay, so you said your parents like they gave up a lot of like they put in like the hard work for you to have this like what you are now. So now, for your future kids, what do you want them to do? Are you gonna try to make them dentists also, or now that you see how long it took you, that you're still may almost be out of debt, what are you gonna recommend to your kids?
Well, I mean, as we know right now, the times are getting kind of crazy, and tomorrow is not guaranteed. But
Facts.
But I mean, I think just like, I would just want the best for my parents. Maybe give them my kids, like, give them the best opportunities, set them up for the best successes, and then from there, I don't think we impose our will. I think it's easy for me to say I don't have any kids, but I wouldn't want to like force my kids to like you have to be a dentist, because what if they're really gifted in arts and they're really gifted in some other department? Maybe they're really good at engineer or something.
Bro, you can make a lot of money nowadays doing.
You could do whatever you want, but it would be nice for them to be passionate.
Yeah, bro.
Passionate about
There's
what you
like
do.
this 12-year-old YouTuber. I think I saw on like a podcast with what's that? Impulsiveness or whatever.
Yeah.
I forget his name.
Ryan
But he was talking. Yeah, but he was talking to this 12-year-old who made like off YouTube. He made like over $800,000.
Yeah, but you know why? I mean, this is probably completely off topic, and it's like nothing to do
a little
with
bit.
industry. But it's like they said that China did it in order so like America dumbed downs all the new generation.
Correct.
And they're looking at long term. So now kids want to be dancing on TikTok. They want to be playing video games instead of wanting to be doctors and dentists, where it really matters.
Which is a smart
engineers,
way.
which is like, what do you think China's doing?
Yeah. No, like if
kids
shit.
are gonna be
Yeah.
They're not like, oh, I want to be a TikToker. I want to be.
They're gonna be like
difference
makers.
They're gonna be the doctors.
Yeah. If shit hits the fan, all of America's gonna be TikTokers and YouTubers.
Yeah, that's what I'm saying.
I didn't even think of that.
Yeah, but it's important. Like if shit hits the fan.
For the long term, 100 years plus. They're not working for like the next 2 years. No, they're thinking about 100 years from now. We're gonna have all the doctors then. But okay, that's.
But anyways, bringing it back, something about like a good thing you brought that up. But I know that you travel. I've seen on your Instagram that you travel to different countries to do dentistry.
Yeah, no, that's awesome. My senior year of dental school, I was fortunate to go for 5 weeks to the Dominican Republic. And for 5 weeks, we set up a makeshift dental clinic in the jungle.
What?
Yeah, like, so 12 of us went, but we were in pairs. So 6 different campos were made. And there was senior nursing students, senior medical doctor students, senior pharmacy students, and then senior dentist students.
So
two and two all went and made a campo. But the dentist was the highest demand. And so, yes, to answer your question, Christian, I have gone. That's, I think, a passion of mine. I think I'm hopefully someday in the future, God willing, I'll be able to start a dental clinic in my parents' hometown. It's in the works.
Oh, wow. Okay.
Where's
But
your
like,
parents' hometown?
They're from Matanzas, Jalisco.
Mexico.
Guadalajara.
Guadalajara, the capital.
Yeah.
But that would be something that I can maybe set up, maybe bless another dentist that works year round.
Yeah.
And then I'm just coming in and checking in, but also bring a lot of the cool technology that's in dentistry right now.
That's a big thing.
And you're able to do stuff now in like a little place like Matanzas. Be able to send things digitally.
Yeah.
Maybe have DHL, bring in the cases.
Yeah.
You could do that kind of stuff, veneers and all that. I could, if I wanted to, in Matanzas. But I mean, I want to go out there and help the people out there.
Don't you think that there's, I don't know, like the money that, but bro, everybody right now, they're flying out to Colombia, they're going out to Tijuana, they're spending thousands of dollars.
So real quick, let me answer that real quick. I just had a patient today from Colombia. Her crown came out.
That was another thing.
That's the next.
We were gonna ask you, do you?
Yeah, and the whole thing about her, she was getting married at the end of the month.
Oh shit,
bro, her thing, it was beautiful, but the whole tooth came out with a little post and a crown.
Oh my god.
She came to me and was like, "Yo, like I need your help desperately." And in dental terms, we consider that a parking lot guarantee. We say, "I'm gonna glue this thing back in, but I'm only guaranteeing it to the parking lot."
Yeah.
Because it's like this is like boo boo.
Yeah.
And this ain't gonna work. And I had to do like some heroic dentistry. I had to pull out my Superman cape. And we had to we glued it in. And she was like, "Oh my goodness, you saved the day." But I'm just like, yo, I had to educate her. I'm like, bro, you can't be eating on this thing,
Because it'll get fucked.
It'll get loose again.
You'll be like, that shit
I'm like, you
special.
got to make it to your wedding. And then let's come back and see me. We had to do more of like a long-term thing. Like,
He's like, do not eat. Do not
so
eat.
that's what happens. And I was at practices early in my career where it was high Hispanic population, where you would tell these patients what they needed, and then they went ghost and came back, had the dentistry done, you proposed, but it was failing.
Yeah.
And it was leaking. And it was the cement. You took x-rays. The cement was everywhere. And the gums were all inflamed and bleeding and painful. And
Because they went somewhere else.
There's
Colombia.
even been some garage dentists.
What?
Stop.
Yo,
Some of these dentists that come from their different countries, they don't want to continue to do their dentistry career here.
Yeah.
Because it's like, it is hard. You know, you got to
Yeah.
do dental school all over
And you gotta
again.
pay
Get all the
like
debt.
that.
And, you know,
Yeah,
some
yeah,
people are
yeah,
just
yeah.
like, I don't want to do it. So that, you know, it's easy to like just get stuff like on the low and just
Oh,
like set
really?
up a little bit like a little
Little
garage
dentistry in
clinic.
the
Do you know
garage?
anybody
Yeah.
in Bradenton?
Chill.
Nah, bro, I ain't trying to get no plug, bro. I don't know
I ain't
about that,
trying
but
to
I
get
have patients
fired.
that come in and are like, they're like messed up, and I'm like, yo, like, what's up? They were like, oh, I went to some garage dentist.
What's
So-
like the worst way you've seen someone fucked up? Like where you looked at it and you're like, bro, this is like their mouth is destroyed.
I mean, there's some of these things when they're glued in, they use these really strong cements. If that's
Yeah.
not cleaned properly, it's gonna like cake on your roots underneath the gum, which you
Yeah.
talked about periodontal disease.
Yeah.
It's gonna simulate like tartar underneath your gum. Excuse me. That stuff is irritant to your gums, bro. Your gums will be all red and bleeding, and it's painful, man.
Yeah.
You ever had somebody with a toothache, bro? Ain't no joke.
Yes, bro. I had a toothache. That's when I got my root canal, bro. I was crying in the Walmart parking lot, calling everywhere. Some people were like, "Oh, yo, it's gonna take 3 weeks," and I'm calling, like, "Yo, I got cash. I'm ready. I want to pay." I finally found somebody in Palmetto, and they did the.
It hurt
canal.
that bad?
Bro. I was crying and I was going like.
I have the
this.
same story.
Why?
I was
Where
bro,
where was it hurting?
Toothache is actually worse than pregnancy.
What? Is that real?
Toothache?
Hold
Yeah.
on, doctor?
No, it is. The
No,
pain,
no, wait.
the
I've
pain-
heard of some patients say that. I've had grown men in my chair crying, bro.
Yeah, bro,
Really?
the
Like
pain
Mr.
of-
Clean grown men, like just
the-
like
the
like
toothache.
just like
No,
like
the-
this, like homeboy.
Yeah.
Bro, the
Homeboy was crying.
No, he's never.
I was crying. I have a root canal in my tooth too.
What's
I can speak from experience.
No, but the thing is, like, bro, the toothache
It was
is, like,
hurting,
search
bro.
it up.
I have
It's
a
like
I have a root canal in my mouth too, bro.
I'm not gonna lie, I was crying too.
toothache.
What, root
What
canal
is a
too?
root canal?
No, when I had some work
Some
done,
toothache
I
done? Yeah,
cried,
okay.
I ain't gonna
What the
lie.
hell's a root
That's
canal?
hard.
The root, bro, my nerve was dead, so I didn't feel shit. But
So eventually, the cavity eats through the different. So your tooth is like an onion peel, different layers of your tooth.
Uh-huh.
There's the enamel, okay, which if it's the white part of the tooth,
Yeah.
you can bleach. There's the dentin. It's underneath. It's more of a living tooth part, and then there's the nerve of the tooth.
Uh-huh.
Sometimes, if you ain't going to your dental visits, you'll get a small little cavity that forms in the grooves of your teeth.
Okay.
Or between your teeth, and then those start growing deeper and start eating through the layers of the tooth. Eventually, they get to the nerve of the tooth.
Mm-hmm.
They can make the nerve of the tooth very irritated, and that's
Uh-huh.
where you get that toothache.
Uh-huh.
Like nothing you can do to stop the pain. Like it just comes spontaneously, and it hurts like level 10 out of 10. I had a patient like that today.
oh damn.
Or there's another kind where
How
the
do
tooth
people-
dies, and then the nerve dies, and then infection sets in. And you get an abscess.
yeah.
Sounds like he was getting an abscess.
Bro, like
What the hell's an abscess? Wait.
Abscess is an infection because think about it. It's like the tooth died and all its guts got spilt out in the bone where it's in the jaw.
Bro, when it hurts.
And it hurt.
so bad.
The bone is only so thin. It doesn't have a lot of space to kind of expand. So when you have tooth pain, there's not a lot of just room for that nerve to expand in the little tiny root canals, the root of the tooth.
Yeah.
And it's the toothache. That's just like, man.
Yeah, I've never had a root canal, so I don't.
Well, you're blessed then. You're not a root canal.
But like, how do people
Nah, I
let
haven't
cavities
done.
get that bad? It doesn't make any sense to me.
I mean, I was young when I had my root canal.
Because
So,
like, bro, like, did you not like?
Alex,
No,
we're
mine
not
was, like, 3
perfect,
years
okay?
ago.
We're not perfect.
No, but I'm saying though, like, did you not like realize like, holy shit, I got a hole in my tooth?
Well, that's where it came out bad. No. It was,
you got a good point, bro.
I'm being
I
real,
mean,
like, bro.
I went to a dentist.
Yeah.
In Onico.
Yeah.
I don't want
So-
to.
It's actually called One Coat.
Skirt.
in one coat.
Oh my god.
And
That was so corny.
They messed up my filling.
And so
the
then
filling-
something grew worse.
Something grew worse in the filling.
Oh,
My breath
bro.
was stank.
It really
and
stank bad.
then-
I
Yeah.
remember
then
that.
It just got worse.
And then it just started hurting. I get it all the
Bro,
time.
My pain was so bad. I was crying. I was like, "Yo, please! Like, I have cat." It came out to like $1,300, and
So you paid $1,300
But yeah,
in
at that point,
cash.
yeah, you
but
would. 'cause,
after
like,
an
the
You would,
pain,
man.
Like
I'm
the
telling you,
pain.
this pain is like something, like they say, tooth pain is worse than like it's
Pregnancy.
equivalent or
A little bit
Worse than
than
pregnancy.
pregnancy.
Without the epidural. I don't know from experience, but
No.
I've heard it.
I hope
Patients
not.
have said it.
Man, I don't know.
Patients have said it.
It's at the same scale.
I've had patients say it.
That's
Jeez,
crazy.
so just random question: can you die if your tooth gets infected and you don't take care of it because of like?
Yeah. So that's a really good question, because if you let infections go, sometimes they can be okay where it doesn't cause you pain. There are sometimes the infection does cause more harm, and it could actually end up causing you to have very big reconstructive surgery in your jaw, because maybe it eats half your jawbone.
Mm-hmm.
So
Now they got to take a bone from your leg,
Yeah.
and they got to go put it in your jaw and make your jaw again.
So
After they take all the tooth and the dead bone.
I've had a family member
I'm getting to.
in Mexico
Yeah.
kind of go through that, but I didn't think it was true that he had like I guess an infection and he let it. Obviously, down there's not like you can walk into a walk-in dentist or anything, but it was so bad that the pain. And then I guess it got so
Infected.
I don't know what infected that it went into his
Neck.
bloodstream and stuff like that, and like he died, like he just
Jeez.
like that's what I was
That's
like,
extreme, but yeah. But it's
I'm
true,
like,
man. It's
What
true.
the fuck?
It's true. And so that's the thing with patients that are walking around with chronic infections, meaning they're there for a while. That bacteria isn't meant to be in your jawbone. So it's mixing in with your blood. We talked about periodontal disease, how it can have health links with diabetes and hypertension and stroke and all that. It's because the bacteria in your bone underneath your gums shouldn't be mixing with your blood. And it is, because think about it, your body is just like constantly circulating.
Yeah.
So it's getting the bacteria from your mouth, it's pushing it into your blood, into your heart, and then the heart is pumping it out to the rest of your body, and it's going on for months and years.
Yeah.
Takes sometimes years to manifest that kind of stuff, but eventually your body just can't. It can't hang no more, bro. I'm sorry to hear about your uncle.
Yo, no, thank you. Again, I didn't like believe it. I thought it, like. 'Cause
Yeah,
you
that's
never
extreme case,
hear
but
it.
you hear it. An oral surgeon is a specialist that is really good at taking out, maybe extracting. I take teeth out too, but in some cases like that, you might need an oral surgeon because patients might need to be put to sleep. Because
Really?
think about trying to numb a tooth that is just unbearable like that.
Yeah.
Bro.
Did they have to put you to sleep or no?
No, but they were putting like
Hella anesthetic in
they
there.
put like 3 here and like 3 down here. I
Just to
didn't know
like
if
just to
anything-
numb,
just to
the
numb it
shutting
up,
off,
yeah. And
Yeah, the guy was like, "You feel that? Nah, bro." Plus, my nerve had died. There was no feeling in it.
so he was Gucci.
So
then.
what do they do whenever they fix him like that? So what do they like?
So they got to get the infection out.
Yeah, how do
I
they
was
do
actually
that?
just in Utah. I was in Utah recently. This past weekend, I was at a
I've seen that
course
thing.
on root canals. I know it sounds kind of boring, but it is something where you can immediately help a patient out. So imagine Brian when he left that office that day.
Right. Was it like immediate? Like you?
Immediate
stop.
relief.
Yeah.
Stop. Like I was so excited. And I ate that day. Like they were like,
You're right.
They were like, "Yo, it's gonna probably be. You'll feel some pain for like 2 to 3 more days, bro." As soon as I walked out, maybe I had a little bit of pain, but that was
It was bearable
nothing
enough to what? Yeah, to
compared
what
to
it was.
Like
That makes
bro,
sense.
I was so happy.
And talking about that a little bit, what would you like? You have the chance right now.
Yeah.
How would you, or what would you tell like the Hispanic crowd? Because
Sure.
again, going back to the whole thing, like I know like a lot of my family members like don't like to go to the dentist because like either they think it's too expensive, they think you need to have insurance, they think you need to like
So
be on it.
yeah.
What do you could tell them?
So being Hispanic, I think we're just naturally going to be susceptible to diabetes. I think
Yeah.
a lot, we eat a lot of sugars and stuff and a lot of tortilla and all that stuff in our diet. So naturally there may be diabetes that runs in your family, but a lot of that might be associated with how your gums are looking.
Oh.
Imagine if
Oh,
they've
that's
been
crazy.
cleaning for a minute.
Yeah.
They have that gum disease that we talked about, diabetes. Maybe they got the diabetes because of the gum disease.
Yeah.
Or obviously the diet is a big contributing factor too.
Yeah.
But I mean, to tell, the Hispanic or even just any patient out there who doesn't, regularly get checked up, I like to tell my patients it gets more expensive when it gets more extensive.
Oh, that's
Gotcha,
hot.
yeah, yeah,
That's
yeah.
hot.
Does that
Yeah,
make
yeah.
sense?
Yeah, it
Like
makes sense,
we
yeah.
can do a little filling for maybe $200, but let's say you don't do the filling. Now the filling needs a bigger filling that costs more money.
Yeah.
But now the tooth might start hurting. Now you need a root canal. That's racks.
So you're talking about
And a crown.
And talk about
so
that,
what was
how-
a little
yeah.
filling now has become a $2,000.
and talk about
tooth.
that. How cheap is it to get seen as far as even for people who don't have like
Yeah.
dental insurance?
Insurance or-
So my company, Greenberg Dental, we have a discount dental plan
Yeah.
for patients that don't have insurance. You get considerable discounts off of what's the usual and customary rate, meaning if you didn't have insurance and you go in a dentist, you'd be paying this price.
Yeah.
So they discount it X from every procedure as a discount plan. It's $89 for the year for the individual, or $139 for the family. Family can include, 4 or 5 people.
Yeah.
But essentially, you're getting considerable discounts on the procedures that may be needed: cleanings, fillings, wisdom tooth or tooth extractions, root canals, bridges, crowns, veneers. Those are all discounted.
Like all of it.
So, and I do a lot of that. I'm a comprehensive dentist. I do a little bit of everything. One of the things that I'm aspiring to do in this year, at the end of the year in November, I'm going to go to Guadalajara, Mexico to do an implant course.
Yo.
Dental implants for a week.
And what's that?
boy.
Like
boob implants?
Nah, bro. Like,
My fucking
well, that's
dad.
good. No, yeah. So you just know what a dental implant is, no? No.
Like, are you talking about like los dientes, like your
Los
fake
tornillos.
teeth?
Yeah.
Like actually they screw in
so,
fake teeth.
Yeah. So let's just. I'm gonna be very quick with this. I don't want to get technical, but let's say you lose a tooth.
Yeah.
Some of us who are listening to this right now may be missing a tooth in their mouth.
Yeah.
Maybe
Yeah.
between 2 teeth, or a back tooth, or maybe they're wearing a little flipper thing because they're missing. They never grew in an adult tooth in the front.
Yeah.
Yo,
I
that
got
was
You know,
me.
yeah.
That
You
was
never
me.
you never grew an adult tooth in
But
the
we'll
front?
talk about that later.
So essentially,
I'm
a
like, look,
dental
I never seen
implant
that.
is either titanium or ceramic, but the research has shown that integrates with your jawbone.
Yeah.
So now let's say you're missing a tooth. Let's say you're missing your first molar, what's like a workhorse tooth. It does 80 to 90% of chewing for you. You can do, let's say you just have gums there. So a surgeon or somebody like me in the future will be able to take a 3D scan of your jawbone and plan out the placement of a screw in your jawbone that fits your jawbone.
Yeah.
And after about 4 to 6 months of healing, of it taking, I can put a little crown on that screw.
Yeah.
And now it fills in the gap, and you can floss it like normal. And it's like a bionic tooth, but it's got pros and cons, just like anything. But I think the pros are that you get the most natural tooth feeling when you chew on it and when you clean it.
What's the con?
The con is the price. It's about $5K a tooth.
God damn, son.
$5K an implant, bro.
That's strong arm robbery.
That's
right
that's
there,
what we
bro.
got in 500K, bro. I'm dead, bro.
That's
That
strong arm robbery right there, bro.
quick
5K,
question.
bro. That's cheap.
My boy said, "Pull out your wallet, son."
He said, put out the credit card.
Give me everything you got.
Quick question though. How many teeth, let's go around. How many teeth do you think are in your mouth?
Isn't it 50?
32.
Isn't it 52?
Hold on. So what'd you say?
32.
50? I feel like 52 is a lot.
You can't.
32 or 36?
No, hold on.
32 or 36?
I'll go with 37.
I'm gonna go with 34.
32 or 36.
So that is a
With no wisdom teeth.
question that's like there's no answer because I have an extra tooth. So I really
Oh,
at
you
one
weird
point had
like that.
33.
Is that
Oh,
what you look
oh, that's like
But
a
it's
physical
32.
number.
32.
32.
Oh.
I didn't know. My,
But then we didn't
my
bet,
dumb
but
ass
they-
52.
At one point in my life, I had
I
33
think there's a
teeth.
2 in there somewhere.
Where? How is it extra?
I have an extra tooth.
Where?
Look right here.
Oh, I see.
Yo,
it.
have you ever seen? Yo, Brian.
Does
have
it,
you,
the hump on
does
the
it
gum.
talk?
Brian, have you ever seen Tom Cruise's smile?
Oh, I heard of that.
Brian.
Oh, the one at the back.
See the hump?
Yeah, but that's not. It's not
There's a tooth underneath the bone, bro.
Yeah.
but that doesn't.
Brian, have you ever
It's
seen
extra,
Tom Cruise's smile?
like me.
No.
Okay, so you know how like some people smile symmetrical? Where it goes straight
Tom
down to your
Cruise?
nose, and it's like this. Some like Tom
Why
Cruise's.
is
If you look
that?
at a picture, the center of it
Because
is
we're not
side- it's over
symmetrical,
here.
bro.
Why?
Nobody's symmetrical. There's
It
something
is.
called the golden proportion.
Yeah.
That's like
My girl has
natural beauty and aesthetics
My
of
girl
your
has-
teeth. Your front teeth should be only so much width of your lateral teeth, so much width of your canine teeth.
Yeah.
For it to, and it's called the golden proportion, so that it would look the most aesthetic. So when you smile, people are gonna be like, "Dang!" Like
But
they
there
got
were some
hooked
people
up.
who got it like fucking sideways.
But there are people that got it sideways, yeah, and that's just because they were maybe whatever reason. But sometimes braces can correct that, braces.
Yeah, braces.
had
I
braces?
had
I
bra-
had braces.
I had braces.
Dude, I had gaps.
Let me see. What happened?
I had gaps. I used to.
You didn't wear your retainers?
I
I had Banana Republic.
Never, yeah,
You had a gap?
out here.
Gap. All right.
we were out here.
What's the dentist's favorite store? Clothing store.
Oh what?
Tart.
You just said it.
Banana Republic.
The Gap.
The gap. Another joke. Quick, another joke. Another joke.
What you call a bear with no teeth?
Bearless.
Bearless.
No.
Boneless.
Rib.
Teethless.
A cub.
Gummy bear.
Ah.
Dang.
That's why.
Corny dad
Yeah,
jokes.
okay.
That's
fuck
why.
with it.
I
going
already
hard.
told you my religious flosser one, right? Yeah.
Yeah.
Christmas and Easter.
Oh yeah.
Yeah, that was Yo, I be getting these patients with them jokes though, man.
Yeah.
So majority of my patients come in with high anxiety.
Wait.
Yeah.
I had a girl named Wendy that came to your office.
Nah, bro, nah.
Oh, did you?
You know Candace?
Candace?
Yeah, about Candace. You know Candace?
That's funny as fuck, bro. That's
Yo,
Oh,
we'll discuss
y'all
that
sound
after. We'll discuss that.
I really thought he had somebody yesterday with a donation.
My boy said actually Candace.
Yeah,
bro.
he messaged us.
He's like, yo, Christian, one of my friends that went to school with you, he wants to donate money.
He's like Candace.
Well, we'll talk about that later.
Man,
We'll
that's
talk
funny,
about
bro.
that later.
So hey, real talk. I want to talk a little bit about dental anxiety
Go ahead.
because I feel like
Oh, people
I
are
feel
so
like
scared.
that is one of the main reasons that the reason why you get a patient when it's the worst case scenario because they were so scared to come when it was
Why
so
are people
small.
so scared of the
Nothing,
dentist
nothing.
though?
Nothing, and now they're like got this big infection that's gonna cause racks to like fix.
Why are people so? What's
Hold
like
on,
the
let
typical
him
anxiety
finish.
for
Let
for
him
dentists?
finish.
I have a
Hold on.
reasoning.
Hold on, but let
why
him
I'm
finish though.
scared.
Let him
No,
finish.
He wants to know why I'm scared of the dentist.
No, but let him finish though.
I was scared of the dentist because
I-
they used to tie me down.
So hear me out. There was a dentist local, Dr. Bowles,
I think that's my dentist.
He used to tie you down.
Bro,
local dentist here in Sarasota.
Well, bro, stop moving.
Bro, like I wouldn't move,
Bro,
but
it's because he would
kid-
say stop, and he's like, I'm no
but I was a
English.
kid.
No
I was a
English.
kid. I was a kid. I was like 8, and they
Yeah.
would tie me
Yeah,
down.
no,
bro.
they do that sometimes. So real talk, I got patients that are adults now
Yeah.
that got seen by this children dentist back in the day. They're adults now. So 20 years later, yo, they were like white knuckling, bro, in my chair. They were like this.
Scared.
They were like, "What are you doing now?" You know, like
That
they were real
bad.
scared. Yeah, and I'm like, "What's up? Like, what's wrong with you?" Like, not what's wrong with you. I said, "What's going on?" Like, I'm trying to build rapport, a relationship with
Yeah.
them, and then they start opening up about how they had this scary. They tied me down and they injected my gums and they didn't get me fully numb and they were yanking out my teeth. I mean, that's traumatic, bro.
Yeah, it is, bro.
You know what I'm saying?
My boy's
So
shaking in the
dental
chair.
anxiety is very common in dentistry. There are different kinds to get you comfortable. I do something called conscious sedation. We're able to prescribe you a pill. It's a drug called a benzodiazepine,
Get him high.
and we get you on a benzo.
Whoa.
Gotcha.
And so we get you on some type of I'm blanking right now on the names, but we'll give you a pill, one you take before the visit, and you bring the other pill with you, and you take the pill 1 hour before, and you get really chill.
Yeah.
You get kind of pushed out, and then we use that nitrous on you after concurrently
Yeah.
with the laughing gas, and you're kind of just like, dang, you're like in paradise.
Is it true? Like I've seen people come out of the dentist
And
and
so they
like,
get the anxiety's gone.
So you're
you know?
high.
I guess.
In a way.
You
I never tried it.
I've always seen people like on videos like they go to the dentist, they get high as fuck.
It's your head that.
Is that true?
What is it like? What
Is-
is it like having somebody like that?
Well, if you do
tell
what's
the
called
truth.
IV sedation, so
What-
there's
how is
there's
this?
a
Yeah.
there's a more of a conscious sedation, which they take pills and they're fully awake and not asleep. Then there's IV sedation where they physically put you to sleep.
Yeah.
Like an oral surgeon will put you to sleep to take your wisdom teeth out. They use heavy drugs in there, like some heavy stuff that when you're coming off of it, it's still in your system, flushing out. But then they're like on, YouTube or TikTok, and they're like getting put on blast.
So
and
those
stuff.
are true though. Those are
That's
true,
no
like,
cap.
So like people aren't acting. They're not like.
No, they're on one.
That was it.
They're on one. They're high as fuck, bro.
Yeah, on one.
Etsy came out when they took out her. Remember, bro? She was.
What she
You get them on
say?
YouTube, bro. Like they
I
be
have a
saying
video.
wild
What was
things
she
too.
like? What was she
They be
saying? Like
saying
what?
wild
Like
things.
what's
Yeah,
wild? Like what
recorded
was?
stuff.
I don't remember.
You don't
Bro
remember?
could be like, come again.
What's like the what's like the craziest thing someone said out loud on like high as fuck under like that shit?
Man, I got a funny story, but I can't put my dog on blast. So
No,
I
No,
ain't
no,
gonna
you don't have
say
to
it.
say his
Don't say
name.
name, don't say
You don't have to say his
But
name.
we know it's.
Hip
Like,
hop.
Martin
He was in.
Garcia.
He was an oral.
Don't say his name.
Don't say names.
His name's Tom.
He was somebody that
say
put
Tom.
his dad to sleep and was doing some work on him.
Yeah.
And I guess he was like still like wrestling and like still not fully asleep. And he started talking about a man's junk.
What?
How he was like talking about the size and stuff about his son's like junk.
Junk.
Yeah.
He's talking about
and
his-
all these nurses were there.
His son's
and they
dick?
were all giggling and stuff.
He was talking about his son's dick.
Yeah. Like how he was like hung or something.
What the fuck?
Oh.
I guess the nurses told me that he was on one and like he
He
was
just-
saying he was just like his dick or something. You know what I'm saying?
His son's
Yeah.
dick.
Yeah. And then he was the oral surgeon there, like, doing things.
High as fuck,
He's like,
bro.
"Dad, please."
He's like,
stop.
Dad, he's like, okay, push the other drug, push the other
He's like-
Put him more to sleep, put him more to sleep.
He's like, hey,
That's what he
girl.
said. He said, okay, push the drug, push the drug.
That's
Give me- give me-
crazy.
Yo, talking about that. Have you?
That was
had-
wildin' though,
have
you know?
had,
Yeah.
like,
Just
put 'em
a
on blast.
pretty girl that you like that you see there,
Bad
but then
guy.
you're like, yo, your teeth are like messed up,
Jeez.
or you know what I mean?
Y'all went in, man.
like-
That's every day.
For real?
Oh, snap.
Like a pretty girl, and then
Yeah,
and then
I
she
mean-
smile, you're like, God damn. Dude,
you were a 10, but
During COVID, she had a mask on.
like,
Took it off, and she
goddamn.
was
Like, dang.
you gotta fucking warn somebody. Hold up.
They say your smile is your business card.
Bro, it is, bro. Your smile's an
So-
asset.
You
Your
need
to
smile's
get
an
me in
asset.
next week.
So
Your smile is such an
so
asset.
your smile says a lot about you. Said a lot about your personal oral hygiene health.
Yeah.
How you take care of yourself. So I mean, some of these things maybe like you ever seen somebody when they smile and they got like a lot of gum when they smile and they got these little teeth.
Yeah.
yes.
They're like, you know, like that. But I didn't even like that because the gum is overgrown. There's a procedure that can be done where they do a crown lengthening, aesthetic crown lengthening, where they remove some gum around your teeth. And then when they smile now, their teeth are bigger, and that changed somebody's life, man.
I've
Yeah.
seen that because usually like some people have smiled and they're like you see their gums before you
The
see
little
their
teeth, you know,
if
they're
that
like,
makes sense.
you know, like, yeah.
Yeah.
I've seen that. And how much is that
And
running?
that's of like not because they did something. It's
That's
just
how the
genetics.
genetics. That's how they were
Oh,
born.
I would blame
or
your
some
parents.
people, you know, maybe subconscious about their crowded teeth or something. You know, they just don't feel swag.
Yeah.
So we can do stuff like braces and stuff, and,
Mhm.
and bonding, cosmetic bonding, and whitening, and
Mhm.
maybe they're missing a tooth. Maybe we do an implant or a bridge or something. You know, to be able to like. I had a friend who
Do you
for a
do
while
like-
there had a little flipper in his front
Yeah.
tooth. Came and saw me, man. We hooked him up with a bridge. He wanted that whole like kind of smile makeover, so we just did a bridge here and veneers everywhere else, and we changed a man's life, man.
Yeah, no,
he was
bro.
live.
You know what happened? That's kind of like touching
Throw-away
a little
slipper.
bit back on mine. So on mine, I had that where my tooth didn't come out, like my baby tooth
Yeah.
fell, but my real
Which
tooth.
tooth?
It was like either on the it was either on the bottom or on
Something
the
happened.
Smile?
Oh, it was in the
Something?
back, so it didn't affect your
No,
smile.
So what they had to do is they had to take one out for cosmetic, and then they would have. That's why I had to wear braces.
Close
They
it
had
up.
to close it, but it was like it was wild.
And that's
Like-
why you got that sonrisa de colgate. Yeah. Okay. I got you.
But that happened to me. My tooth fell out, and then this one wasn't coming out.
But why? Why does that happen? Like, is it just genetics or why?
A lot of the stuff, I told you I got an extra tooth. So, I mean, a lot of this stuff is if, I like to say baby teeth and adult teeth like railroad tracks.
Yeah.
If the adult tooth gets off the railroad track, it may have a hard time getting out or it may get stuck. And you got to go in and have an oral surgeon do something where they, with braces, pull a little chain on the tooth to bring the tooth in your jaw.
That can happen.
I've seen that.
Yeah.
I've seen that where like their teeth is here and then they like it goes either into like
Yeah,
pull
it's in the
it
jaw,
out.
like,
That
and
happened to
they
Marvin.
got to expose it and move it down, you know?
Marvin's
Man,
Oral
canine.
surgeon
why
does
you
that.
exposing my boy
No,
Marvin
Marvin's
like that.
canine was like up
Yeah,
here,
you're
boy.
supposed
Oh yeah, he had it there. They had to
Yeah.
pull it out.
That's why they call it the eye tooth, because it was forms in by your eye.
You're lying, bro.
Oh, snap.
Yeah, bro. Real
But
talk.
yeah, no, Marvin's like was up here, and then like came down, and it's like perfectly straight now.
They had to
Yeah,
pull it
all
down.
y'all got nice smiles, man.
Well, that's because we you take care of our teeth.
I don't like my
I'm
smile.
1/3 of these guys'
Next week,
dentists, and
next
2/3,
week,
which would
next
be
week.
scary.
Go, let's
Yeah,
go
no,
next
I
week.
know.
Let's
I
go.
really need braces though. I want braces. You gotta hook
Can
me
you
up with
smile?
braces.
Smile.
Cause like the side of my mouth, I have like a
Can't
box.
he just get, okay, so what do you recommend?
'Cause I have literally, it's like a
Direct
box.
Club Or
No, so
No, no,
there's,
no, no, no. Oh wait, go ahead.
So
Yeah,
there's
tell me
actually
about
something
that.
going on with that. There's lawsuits.
bro.
What?
Yeah, where they would like mess people up, man.
Yeah.
Are you
Yeah, bro,
serious?
I think
Or
messed up
they
my
they
girl.
took they collected they taxed people and then they never sent them stuff.
Yeah.
That's kind of
Mhm.
sketchy,
we
bro.
need
Those smile direct now things.
But you
like-
know, here's a plug from my orthodontist, man. Yo, it's like a couple $100 down and then it's payments, bro. It ain't like
for braces.
yeah, it ain't like you're
What
dropping
does it
5K
actually-
down or
is it-
something.
Does it actually help? Like if you were to actually do the steps for Smile Direct now, would your teeth actually get straight?
It just
Like, be hon-
the
like-
scary part about those is that they have you take your own impression and send it in.
Why is that scary?
Because
well-
you might do it wrong.
Well, who's checking these things? Who's doing the treatment planning on these things?
Oh.
Who's moving these teeth? Could be like somebody who's non-dentist doing this. So you want somebody who's a specialist moving your teeth, or some
Oh, I see
algorithm
what
on
you're
a
saying.
computer moving your teeth.
Okay, what about retainers? The invisible, what like the
Invisible retainers,
or the like the permanent.
or-
What do you which one do you think we
the
should
hard
go?
ones with the permanent retainers where they bond them on the tongue side on the back.
Yeah.
Yeah.
Those are hard to clean.
Oh, okay.
So if
got
you're
you.
not really good flosser, you got to floss those differently because you can't floss like a traditional floss. You got to go underneath the bar.
Yeah.
It gets tough, man. And then, flossing, as we said, is already hard as it is. You're going to give yourself another obstacle to not floss.
Yeah, that makes sense.
Those are the ones that come in and got that big tartar bridge down there, bro.
Oh my
Yeah.
God.
They got to get in there with that Cavitron, and they
So
just
you
like
don't
chunks,
recommend
bro.
that one?
you
So
don't,
you don't recommend the permanent.
It depends on how your orthodontist is. The thing with that one is you don't have to wear that retainer all the time. If you're compliant enough to wear your removable retainer, then maybe you can go without that wire.
I messed up with my retainer. I never I skipped like a 2 weeks, and then
Oh,
it
what do you
messed
mean,
me
like
up.
after your braces?
Yeah.
Because your teeth are like, what is the deal with
your
that?
teeth went back to regular?
So they're
might.
still good, but they're still like it's like anybody. Like when your teeth, or when something's off you, like because you know, like
I might lost my retainer. I know my teeth have shifted. They haven't shifted that much. I've been lucky,
Same.
but again, I hear what you're saying. Yeah, I mean that's all. I mean that's all part of the
gross
process.
shit,
You know.
Do you have to wear them for the rest of your life, like the retainers?
It's ideal. I have friends that do because think about it. You're just kind of maintaining your smile the way it is. You know.
Makes sense.
yo. So on that, is it true that people lose their retainers like most of the time when they put like
A napkin? Of course, that's how I lost my retainer.
Yeah, that's how I lost mine.
It was like a month or two later, and then like I was in lunch at Booker, and then I put it in a towel and threw the tray out, and then it's like shoot. By the time I was in the next period, and I was like, dude, what happened to my retainer? And then at that point, trash was taken out. And
Yeah. And those are like 200. Like for me, it was like $200 for those retainers. I don't know what the price is now, but like it was like $200 for retainers.
Come see me, man. I'll hook you up.
Come see, y'all hear this? Come
I
see
want
your boy.
braces.
I ain't taxing.
I want braces though, for real. Like I really do want braces.
We'll hook you up with the orthodontist.
What's
You bro? What do you, wait, so you don't do that?
So hear me out. So that's a good thing. That's a good thing. So I'm happy you're saying that because yes, I can do that.
Yeah, but
I'm not specially trained like they
So
are.
why ain't you trying to hook me up?
So it's like a garage kind of. Is that what you're saying?
It ain't in the garage, but there is
orthodontist.
shit. I just going back with what I said. You know what I'm saying? With like you're gonna have some non-specialists do your braces.
Yeah.
I shouldn't, but it's something that just like implants. Some say I shouldn't do implants because only a surgeon or a periodontist does that kind of stuff.
Gotcha.
But I want to be a general dentist that when you come see me, I'm gonna be able to hook you up for everything.
Like I want you to be able to hook me up for braces.
You know, braces, and maybe wait until I start doing braces. I'll do your case.
Yeah.
You know.
Oh, so you haven't done braces yet?
At one job I did, like I never really got into it, man. I was always really big into restorative dentistry. Restorative dentistry is like filling in gaps with either crowns, bridges, fillings. You know, that's like my specialty.
Yeah, because I want
I
braces.
want braces.
Let's get them, Brian.
Okay.
I will.
Okay,
As soon as
okay.
you learn, what do you have to learn?
Like, yeah, what do you mean certified
what's that
braces?
missing step for you to learn?
The thing is, there's only certain cases that I need to identify that I shouldn't treat.
Oh, like when you're like no.
Maybe someone comes in with the genetic makeup of their jaw size.
Yeah.
I should be attuned to those cases and say, no, I ain't doing this one.
Yeah.
There's a lot of cases that are maybe like spacing.
Yeah.
Those are easy cases.
Yeah, okay.
Or maybe a little crowding. How they do those crowding cases with the invisible retainers is they use these little strips that are kind of like sandpaper, and they'll go with the software. They'll know where they need to shave a little bit in between the teeth
Yeah.
so as to have space to be able to align the teeth better.
Okay.
So that can be done with invisible braces or obviously traditional braces.
Invisalign.
Invisalign, yeah, clear.
What do you recommend, Invisalign or traditional braces?
So every case is different, but I think if obviously if you were like 12, traditional would be fly. I don't think you want to be 30 with traditional braces.
Yeah.
But
I wouldn't mind.
but you know what? There are some people that wouldn't mind, and guess what?
care.
It's going to
wouldn't
be
care, but I just
another
want- I
grain
just
or so
want-
cheaper.
Yeah, bro. It's
I'm
So
all about
if
cheap.
you're Gucci
I'm
with
all
that,
about
you
cheap.
Gucci with
I
that.
had braces and I took them off with a spoon and a penny.
I honestly
so
like.
you had braces and you took them off?
With a spoon and a penny, I swear to God.
I like switching colors.
Why?
Because the wire, first of all, the wire fell out, and then the rear,
I hate that.
the bracket in the back fell off.
Yeah.
And my
you just
mom
go to-
and my mom never took me back. I was dead ass walking around with fucking brackets glued to my teeth, no wire. Like, and everybody was like, "Bro, where are your braces?" I was like, "My mom's gonna take me to the dentist," and she never fucking took me, bro.
She snapped.
So I had to literally grab a
She snapped.
spoon.
She's like, we're saving.
Yeah, I had to grab. Well, I don't know why she didn't take me back, but I had to grab a spoon and a penny, and I was sitting there fucking bloop 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 bloop.
Yeah.
Yeah.
Savage, bro.
Is that bad? Like,
No, you did it.
My hood like never.
I mean,
come back.
I still got my teeth, but
But now I know why.
Yeah.
but like my teeth shifted. They were like straight. And then
I hear you.
They just
A
fucking
little shift.
How
All
often?
right.
How many times in your life can you? He's like, all right, let's move on. How many times in your life can you get braces? Or it's like as many.
As
as
I
much as
mean,
you want.
you would hope you only do it once because it's expensive to do braces,
Okay,
you know. So
but
you
there's
want
not
to.
like a medical.
No, there's no medical. No, you could sometimes in life you'll lose your retainer, and then you're later in life
gotta
you're
get
like going
braces
extra
again?
to
Me?
get your braces. You know.
So is there a procedure that you like can only do once, or like try to like not
Take out your tooth?
Like crowns, like you can
Puppetry.
only do a crown, or is it like
No.
like changing a tire?
Stupid, bro.
All right,
No,
it's time.
no, yeah, you know, so your teeth have just like anything wear and tear. One of the main, so this is a great, I'm glad you brought this, Christian, because
Yo, thank you.
here is the next perfect little tidbit that I could give the audience. There's a lot of patients, 9 out of 10 patients, so that's a lot of the majority of the audience hearing right now, are grinding or clenching their teeth
Yeah.
Ooh, in their sleep.
in their sleep.
Yeah, I heard of that.
Sometimes people do it during the day. That's called daytime clenching.
Yeah.
And then there's nocturnal or nighttime grinding or clenching.
When they do it at night, yeah.
When they
And a lot of these things are associated with another thing called sleep apnea,
Yeah.
where they're not getting enough oxygen in their system, so they're tired during the day. Some might even sleep at the wheel, like they might be like at the red light, like just
Yeah.
tired
From just like lack
from
of
lack of
quality sleep.
oxygen, lack of
Just
sleep.
lack of quality sleep.
Yeah, lack of quality sleep. And so with the grinding and clenching, that is going to break down your dentistry in your mouth and your teeth faster. So a way we can combat that is with a night guard. Think about it as a preventative measure. Imagine you
Yeah.
rubbing away plastic as opposed to your teeth.
Yeah.
so
That's
quick-
a way to keep your a crown. If let's say you had a crown in there, maybe you keep it for longer. If you're a preventative thing, you know, like a night time
So
grinding.
quick question about that. So, I got my braces and stuff like that. But I used to have, I think, an overbite. Or
Yeah.
when they correct it, what is it? You're supposed to have an underbite or overbite?
Just a regular bite.
Just a regular bite? No, the only reason why
I hear you
asking
though.
is
You had something going
I
on.
had-
Obviously, there's
like,
an
I had-
indication for the
I had
braces.
something- So then they would like. I remember the procedure was like after they were straight,
bands?
they needed me to like either have the bands where I corrected my bite. But going back, I mean going now forward, I know like it. I don't know if it's the problem or not, but like snoring. I started once I got my teeth fixed. I started snoring because before, like I promise you, I didn't,
didn't snore.
And
Usually, it's the opposite.
what I think is 'cause,
That's what I was
again,
thinking,
I
too.
had like I don't know what it is, but I know like that once they corrected my bite, I think it's like I just don't get air through.
It could be the way your tongue is. If your tongue is,
Let me see your tongue.
if you go like this, you should be able to see your tonsils back there. If you can't see your tonsils,
Oh.
that means your tongue is big. And think about it when you're sleeping like this.
You're just fucking choking
that
yourself.
tongue is just laid back in the airway.
Let me see. Let me see. Go. I can't see your tonsils.
Yeah, you got a fat ass tongue, my guy.
Yeah, you got a big tongue, man.
You know,
You got a
it's
Malin
like-
Patty class 4.
Yeah, so
Mal and Patty
basically,
class
it ain't
4.
your teeth. Fix your fat ass tongue.
I don't know how you fix that.
I can't help you.
I don't think you can.
Help
Well, you know
me.
what?
Well, you think it's because
You know
they
what?
moved his jaw
You know
back?
what you can
I'm
do?
telling
You
you.
can do a device that you sleep in that moves your jaw forward on
Forward,
the bottom.
yeah.
That's what I'm telling you.
Think
because
about it. Your jaw forward on the bottom opens your airway.
Yeah.
Yeah.
I'm
But then
telling
you
you.
walk around like Crimson Chin. out
Well, no,
here.
that'd be at nighttime.
Be walking around like a bulldog.
Oh, only at
Nighttime.
night.
So you wear it at night when you're
Oh.
sleeping.
No, but I'm telling you, bro, because like
needs
I used to like again. I think I had like an underbite, so that's why I never.
I hear
had
you.
anything.
Something happened with the braces that then caused you to snore.
And then they changed my bite because I remember that was a big thing. And then I started to snore. But again, like I don't want to be. Maybe I got a little bit chubbier.
You should do you should do a sleep study.
Did it happen?
You can
when
do a
got
take-home sleep
chubbier?
study now.
It happened. That's what I'm gonna do because like
Do a take-home sleep study to confirm sleep apnea, and then you can get maybe a CPAP or something.
Because I asked my parents because you
That
know
might be
where
extreme,
I used to live
but-
with them, or I asked them like they're like, dude, you never snored, and then like
Just ask the
now.
girls you were sleeping with. Like, dude.
Nah, I was a saying.
I'm dead.
No, ain't no deal. But yeah, that's a question I always had.
So that's that's the long story in short. I mean, people are 9 out of 10 of us are grinding, clenching.
Yeah.
Ways that you can have preventative measures with a night guard, and that's just going to be a way to preserve your teeth. I mean, think about it. You're not going to wear them faster, and they're not going to break down faster.
Gotcha.
What's one thing out here that like you were like, yo, don't buy this, like that are like people sell.
Well, listen, the night guards you can buy over the counter. So you may be listening to this and say, "Oh, I'm just going to go to Walgreens and buy one." The problem with those is that they're not custom made. They can jack your bite up. I've seen it happen. They don't cover the very last molar, the second molar. You're going to sleep with them, and that back molar is going to drift together. The two back molars that aren't covered by the night guard.
Okay.
The night guards I make are made to a certain dimension that's comfortable when you sleep.
Oh, so you can
Plus,
get
it's more custom form fitted over your
So
teeth.
you
know?
can make one for me.
I could.
Like, don't buy
But
the ones at like
obviously, there's
Walgreens.
Yeah, don't go by Walmart. You know,
Oh, they can come to your office.
Yeah.
come to my office and we'll do an exam. We'll make sure there's no cavities. Obviously, you want to make sure that the teeth are good
For sure.
before you make a night guard, because then if you got to remake it because you have to have a tooth changed,
Yeah.
that's not the way that we do it. You know.
For sure. For sure.
What's the best toothpaste out in the market right
So
now?
it's funny. I was just watching something about a commentator was saying how she buys her toothpaste on Amazon. And I found it funny because she was like, yeah, you ever go to like the toothpaste section at like Walgreens? Like you'd be there for an hour trying to get a toothpaste.
Yeah.
There's like 30 different kinds, like looking. I was big into Crest Pro Health.
Yeah.
But it happened to be Amazon had Colgate on sale. So I'm, you know, I got some Colgate, you know, Refresh, I guess it's called. So, I mean, you know what? But it's funny. They both make foam different in your mouth. They taste
Really?
different, man. Yeah. Crest and Colgate is like Coca-Cola and Pepsi. It just tastes different, you know? But it's the whitening toothpaste, you got to be careful with those because some of those have those abrasive beads in them,
Yeah.
which is damaging to your enamel.
Oh, it is?
Yeah. So what you might be more like, you should probably look at something like I used to like the Arm & Hammer.
Arm & Hammer? Like, and it's got like, what
Baking
is it,
soda? I used to like that. It felt good.
But do you feel like, do you feel like that's better than like teeth whitening, like 3D white? The Arm & Hammer
I mean,
with baking soda?
I mean, I guess if they're like, you know, the brand is whatever, you know, I mean, I guess you could try it.
Yeah.
I don't know if I have a say or a favorite or something, but I think any toothpaste that you use is the best toothpaste because you're using it.
That's true.
You know,
That makes sense.
you don't use it.
Are you also more about like you see how now with all this technology, there's the electronic toothbrushes? Do you think like old school brushes or like what do you think?
Yeah, so they did like some studies and like the amount of strokes that you get with the electric toothbrush and manual is like a couple thousand per 2-minute session of brushing your teeth, or
For
a
an
couple
electric one?
hundred, or a couple hundred.
So you recommend?
So
the
you're
electric one?
stroking, you know, a couple thousand more than hand brushing.
So you recommend the electric brushes then?
I think so, man. I think they become so cheap now that you can easily afford one on Amazon.
Yeah.
And like get your skin in the game and get to a better oral hygiene.
Again, I ask because again, like being Hispanic and stuff like that, like not lots of Hispanics like believe in going out and spending like 60, 50, 80 bucks on an electronic one. They just say, you know, there's like this $3 one.
Yo, I used to have
$3
uncles and even my dad, man. You should change your toothbrush every 3 months.
Ooh,
Yeah.
that's a good question.
But I'd have like, remember my dad's toothbrush one time looked like a fan. It was like all
Yeah, it
like
was
you've
all
probably had
fucked up.
uncles and grandparents that have
Yeah.
like the toothbrush that looks like it's got hair and it's like that. It's like,
Like
yo, this thing ain't been changed in like
Yeah.
a year or something.
Yeah,
But yeah, so you should change it every 3 months. To keep it, you know, in a soft toothbrush bristle.
So 3 months.
3 months.
Especially after you get sick or something, you don't want to change that.
I am due for one.
Yeah, man, go get a spin brush and then go on Amazon and buy those heads. They're like knockoffs, but they fit the toothbrush, and then you're Gucci. Like, you know, you just have a fresh one, you know,
Bet.
What about
fresh.
gum? Now that we had gum around,
Is
like
gum good for
Sugar
you?
free. Let me see what the primary ingredient in the gum is.
Why sugar free? Which is because of the
Cavities.
Is that why?
I don't know how to read, so
Ooh, boo
let me
boo.
know.
Made of sorbitol gum-based glycerol. Where's this xylitol? Man, you better throw this in the trash, bro.
what gum do you recommend?
Bro, I just spent like $10 on that.
If you look at a gum, look at the primary ingredient. It should be xylitol
Xylitol. Why xylitol?
because it's a sugar that doesn't cause cavities.
Oh shit.
Fast.
So it's
What
sweetened.
gum?
Yeah, what gum?
I think Trident.
Bubba.
Tried it?
Bubba
I
gum?
hate Trident.
I can't find a Trident that I like, bro.
Trident, or you know what? There's a
think-
gum brand,
I was
GUM,
Oh yeah, I've
and
heard
it's
of them.
fire too
Yeah,
because
yeah.
it's like a lot. There's like a lot of them in the pack. You know, it's like
Yeah, no, I've heard of them.
$3.99. You get like 50 little cubes or
So
whatever.
you're saying those watermelon, Bubba?
Nah, bro, you trying to get cavities, man?
Bro,
so-
they're so good.
So real quick.
Bro,
When I went to the
can't- ever since
Dominican
I went to them, I
Republic,
swallow 'em.
a lot of the kids sucked on fruit over there.
Really?
Yeah, so they sat there and picked fruit off the tree and would suck on it all day. Guess what that did to their front teeth?
Let's guess. It rotted it. It
made
rotted
their
it.
teeth go forward.
No, worse.
It
It rotted
I'm
them.
fucking dead.
Think about the citric acid in the fruit.
Yeah, and the fruit, it literally breaks down your teeth.
And a constant sucking, it broke the tooth down, and you had these teeth that were all like kind of decayed and small.
What about? Do you know anything about like tongues? Like, babe, what do you have?
Tongue?
Well, like the holes are in the.
Don't expose her.
She has geographic tongue.
Yeah, I mean,
What is that
it's-
like when
I
there's
mean-
holes in there or something?
No, it just changes like form or shape or something,
yeah.
right on the tongue.
Like a.
I don't think it's bad. It's just is
like
what it
an
is, you
X-Men
know.
Kind of thing?
Yeah, I could feel it.
Yeah, like
A what?
X-Men.
you be feeling the difference.
It's hard. Her tongue's hard.
So think about it. The name geographic tongue.
Yeah, it just
The
looks
tongue
like-
geographically changes shape.
Okay.
Maybe one day it's like here, and then the other day it's shaped this way,
Shut the fuck up.
and the other day it's. We're not talking about the shape of the tongue, but like the shape of the top of the tongue.
Oh.
Geographic tongue. Imagine like tectonic plates.
Yeah, yeah.
They're like shifting. You
I
know.
thought I thought her tongue was fucking to the left one day, to the right, fucking up.
Yeah, no, I'm like,
Like a
Like
fucking
that?
taco.
she went,
Like a can.
you snap.
you went in.
I'm
You
dead.
snap, bro.
Are we all good?
Yeah. Oh, you have?
Yeah.
it's a good
Oh, go ahead, doctor.
No, bro, you good.
Doctor, take it off. Take it off. Oh, Tampa Bay Rays.
What's our time right now?
What's our time? What are we sitting at?
120.
120.
A couple more minutes.
Couple more minutes, because this is good. This is good. I
Anything
like
else
it.
you guys want to talk about?
Are you single? Oh, I'm sorry. The wrong topic. Sorry.
Are you single?
Yes, I'm single.
Okay.
No, but so what? If you could, like obviously there's somebody watching and it's like, yo, I wanted to be a dentist. What are they looking at? Obviously, we know you said that they have to go into debt or stuff like that. But what's normally like the range of income that they make a year? If you could, again, don't be specific, but
Yeah, I mean, you could make. Like I say this with all.
hay para las tortillas.
I say this with all. Humility.
Mm-hmm.
I don't want to say this because I'm like,
Yeah,
I want to be like showing off or anything.
Yeah.
But you have the potential to earn in one day what someone might earn in 2 weeks,
Wow.
like a 2 week paycheck, you know,
Yeah.
or sometimes even earn one in one day what someone makes in a month.
Wow.
Yo.
You know, so again, I say that not to brag, but but I'm blessed,
Educational.
and you have the potential to make that kind of earnings
Yeah,
because you're producing, you're changing lives left and right, and you're making difference. You're doing root canals and crowns and fillings. I mean, you're not doing something they don't need.
Yeah.
You're helping patients out.
Yeah.
Need.
You know,
Yeah.
Need.
they need, and we're helping patients out. So I think the earning potential is very high. So I don't know what that looks like per year. It fluctuates. The pandemic hit dentistry pretty hard just because it was like, it was scary, like the aerosols that were doing
Really?
dentistry in the mouth. Think about it. COVID was in the mouth.
Oh yeah.
But still, though, think about it. Like, I mean, I understand. It's in
So
the
it was
mouth,
kind of
but
scary for me.
Think about how many people had tooth problems that didn't. They're like older people who miss their visits. Because I guess, I mean, I would imagine the older you get, the more sensitive you become. The more like it affects you if you get like a gum disease or stuff like that.
You could. Yeah, I mean, it could. You're not a spring chicken anymore. And you don't heal. You don't heal the same as when you were young. That's why they say sometimes get rid of your wisdom teeth early rather than late.
I got it, man.
Because you heal so much better, and you're just, when you're
So,
like
like-
18, you're better than when you're 35.
Is there ever a situation where you don't have to take out your wisdom teeth?
So you don't have to take your wisdom teeth out if you can keep them clean and without cavities. So if you can do those two things, then they don't need to come out.
But like you
Once
said,
they get cavities and gum disease, they got to come out.
Not
That means you
everybody
can't
has
clean
it.
them right. Sometimes your jaw is big enough where they fully come in, and they're big enough, and they're chewing on those things, bro. They got 32 teeth,
Damn.
grilling it.
So there's, you mean
I don't even know how many.
36?
32 teeth.
Brian, so it's like, so 73? No, bro,
There's 28 plus
32.
4 is 32.
With the wisdom teeth.
28 regular and 4 wisdom teeth, 32.
Okay, see.
32,
Okay.
32.
But does everybody have a wisdom tooth?
So here's the thing. I had one patient today that only formed one.
Not me.
Okay, so
And I've had patients that only formed 2 on the bottom or 2 on the top and never formed. Some formed 2 wisdom teeth.
In the same spot?
Boom, boom, back to back.
God damn.
Bing, bing.
son.
They're like stacked on top of each other.
Damn, what?
There's a risk. So I'll just say one last thing. So if you're thinking about, wow, like my wisdom teeth, if this somehow just, got your attention.
Yeah.
Sometimes there's high risks of taking the top ones out. The bottom ones out, I'm sorry, because there's a nerve they have to numb down there.
Oh.
And if those teeth are wrapped up in the nerve, there's a high risk that when they're taking the tooth out, they might cause a nerve paresthesia, meaning the nerve. You know when you're like getting unnumb and it's prickling feeling, you'll be like that forever.
Oh my God! For the lower ones.
For whatever tooth is near the nerve, and they talk about it being a risk.
But the top one too.
Top one, there's something called the sinus.
Okay.
The sinus, when you get sinus, headache or sinus infection or whatever.
Yes.
There's air spaces up here, so sometimes those wisdom teeth are really cranked up in the sinus.
Yeah.
So there could be what's called a sinus communication. When they take that tooth out, let's say you drank milk.
Yeah.
It might come out your nose.
What?
Because there's a sinus communication.
Whoa.
So if it ain't managed right, then that's what could happen.
That's fucking insane, bro.
Because it's like, think about it. Your mouth is connected to your what's called your nasal pharynx.
Yeah.
Which is your nose. So I mean, it all kind of is like there, you know.
Yeah.
Your throat.
And that's from taking one out. Like that's if you take one out.
And that's why it's important to come in and get examined, have that panoramic done.
See
in some instances, we got to take a cone beam. It's a sophisticated 3D image.
Yeah.
I tell my patients, I'm looking at a 2D image of a 3D object when I look at an X-ray on the computer screen.
Gotcha.
Correct.
Yeah.
Yes.
I don't know. You know, we don't know what direction or how round or sometimes the nerve, if it's at high risk, you can exactly see how the nerve is located near the root of that tooth.
Yeah.
It reduces risk.
Like this, but then
you can know where it's at. Different cuts. Coronal, sagittal, axial, all that stuff. So it's cool.
Cool. And then one of the last questions, because a lot of people watching, they drink alcohol. What do you say?
Or smoking.
Or smoke. What do you say about these activities?
Yeah. There's even people that dip, put the little tobacco.
Oh, bro, that's so bad for you, bro.
You know. So there's something called nicotinic stomatitis, and what that means, it's precancerous.
Yeah.
Which I'm sorry, it may not be nicotinic stomatitis, but it's something where it causes the gum becomes where you put your little your pouch. The gum becomes kind of like cobweb looking.
Yeah.
What?
It's because that nicotine is just on constantly contacting the gum.
Yeah.
That goes the same with drinking alcohol or smoking tobacco products. All those things can cause staining. If your teeth get more stained, they become more susceptible to getting more plaque.
Yeah.
Alcohol can, you know.
That's when I drink Coke or coffee.
Like a chronic alcoholic could, could really mess up their livers, and then that throws off a lot of the, saliva and all that, and they could really mess things up.
Yeah.
Alcohol, smoking.
Go ahead.
Okay, so what's your outlook on vapes?
Is
that doing anything to the teeth? Like, because I know it hasn't been out long enough, but like you said, smoking cigarettes, it damages your teeth.
It damages more your gums.
Oh,
vaping?
Your gums, okay.
So gums.
No.
So gums.
Your
is
teeth.
the
Think about it.
problem.
Your teeth are strong. Remember, they're strong.
Yeah, they're.
The gums, though, imagine all that toxic stuff in the gums.
Yeah.
It could cause gum disease.
Yeah, bro. Have you ever seen and it's kind of similar. Like, have you ever seen like a house? I don't know if you've ever seen it. Like people moving out of a house where people smoked in there, and it's like literally people are like moving like pictures or stuff like that. And literally, bro, there's from just the smoke and it just sitting, bro. It's literally seeped into the walls. And like where there was once pictures, like if you remove it, it's a plain white part, and then around it you can see where it's like brown from all the smoke. That's the same thing with your gums.
So, Brian, I mean, as far as the vaping goes, I don't really know 100% if that's got a super big thing with the teeth, maybe the gums. But if anything dries your mouth out, if you get dry mouth, the saliva is like a protectant, and it makes your teeth slick so that it doesn't get bacteria on them.
Gotcha.
So sometimes elderly patients have a lot of medications, or maybe just they have medical conditions, or people who have dry mouth. And so if you do have that, you're more susceptible to having, dental issues.
Gotcha.
That's crazy. I didn't.
Any
expect
last questions? Do you ladies have any questions? No?
For
Do you have any last
Dr.
questions?
Jose.
So let me give a shout out here. We'll give it to question. I'm on Instagram. It's DDS_Roque, ROQUE. So it's D as in dog, S as in Sam _ Roque. You can DM me, or again, I think we're gonna send some links up on the thing with my office numbers, and definitely come see me.
We're at again.
I'm either at Greenberg Dental, 5460 Lockwood Ridge Road, next to Crunch, or my primary office is on Bee Ridge in McIntosh, 4280 Bee Ridge Road. Come see me at either office. I like to take pride in being from Sarasota, treating the people in my community, Sarasota, Bradenton area. I'd love to serve you and your family, your friends.
Yep.
You can be assured that you're going to get family-style treatment and also an honest opinion, because you're right. There is a lot of dentists that come to me, patients, and they have a treatment plan from another dentist, and they're getting taxed like $12K or something, bro. Like for like a Hispanic mom that's like working as a housekeeper. Like how the heck is she gonna do that? And so, long story short, like I'm always down to do a free second opinion.
Yeah.
I'm actually doing something right now. Remember the show Extreme Makeover?
Yes, yes.
You know, the Extreme Makeover show. So we're doing something right now for a mother of two. I'm working with a dental lab, and we're changing her smile. I'm also working with nail techs, makeup artists, hairstylists, clothes designers, and we're gonna get this lady like a big before and after.
When are you starting that?
It's already started, so she's in process, but I wish it could be like that, but it's taking time. We had to do surgery on her. We had to put her in temporaries. She's healing. She's getting like a $12K dental job for free.
Holy shit, bro.
We're blessing her.
Damn.
So we're gonna definitely have a YouTube video of that made or something like that.
Yeah, you got that's dope. Let us know. We'll share that.
Let us know.
But maybe we can take over now to do the big thing where they're going to like the hairstylist.
Yes.
And they're going to the place, and then we're like have the video camera with them there and getting her reaction.
Nice.
And then maybe at the end, like we'll do the big reveal with her
will.
teeth, and
I think we should be kind of like
we should connect on that.
That's dope.
No, we should connect on that. So you know what? That's at the core. That's at the core of what my foundation of my passion in dentistry is.
For sure.
The fact that I'm blessed enough to be able to help somebody like that and to do it at no charge, like we're gonna completely change this lady's life. And it's just amazing where technology has come in dentistry. The fact that we can do things faster, easier, more efficient, and more painless. I mean, gosh, you're getting dentistry now at one of the best times.
Yeah.
You know, so definitely give me a ring or a buzz if you want to become my patient. And thank you so much, guys,
a second view
for having me today.
Last closing statement. Do you habla español?
I'm fucking dead.
Si hablo no sabo kid, right? No sabo kid. You know, it's funny, man. My first language was Spanish, and I spoke Spanish to my parents growing up to when I left for University of Florida. To answer your question, I do speak Spanish. I'm very fluent. But it wasn't until I started treating patients in dental school that were just Hispanic.
Okay.
That's when I really started to become more fluid with my Spanish. And there are times that I'll say a word where it's no sabo word or something, But man, dude, I have these Hispanic patients cracking up, man. Like
no, but that's good though. Just so like people that are watching.
I would say half of my patients are Hispanic.
Okay, perfect, good.
So it's a big need. That's huge that I could tap into to help two people, English and Hispanic, and my staff. I mean, gosh, I have one of the best staff. I mean, we've it takes a team,
No, bro, your staff's A1.
It takes
a
team. So I'm blessed to have a great staff that backs me up and is right there swinging with me. Because dentistry's hard. It's stressful. It takes a toll on your body. So to go back to the question about the young girl that wants to be the dentist. You got to understand that there's a big stress level that comes with this job.
Yeah.
It's a lot of precision work. Patients' expectations are very high. Then you got to bring them back down here.
Yeah.
Because they're expecting this. And then you're like, yo, your thing is jacked up. Like, I can only work with what I got, or they don't want to pay or something. It's like, bro, we got to do what's in your means, and sure. so it's a big deal. It's a big deal. And so come see me.
Is dentistry like more? Not that it's more like I've only had guy dentists more than like is it 50-50 or what's your outlook on that?
You know what? I had more girls in my class than guys.
Really?
Gotcha.
Yeah, I think it's a good portion on either sexes, but I think I don't think there's a some prefer a man, some prefer a woman. I don't have a right or wrong, whoever you feel comfortable with.
For sure.
Any last
No, that was it. I think I
No.
learned a lot.
Cool.
Yeah.
Well,
Thank you guys.
We want to thank you for taking some time from
Course.
your busy schedule.
For real,
and,
bro.
You know, for helping us out, kind of teaching us, showing us
Of course.
other things that we didn't know. And again, we're gonna put his information in here.
Hit up my boy for a cleaning.
Yeah, cleaning, any work or anything. We're gonna put.
Yeah, I got a hygienist, so she'll definitely hook it up, and
Yeah, I'm gonna need those braces.
I'm
bro,
over
no cap.
here. You know, we'll help you out in anything else we can as far as the teeth go. So, thanks again, guys.
Cool.
For sure.
So thank you. All right.
All right.
All right, guys.
Thank you.
Dr. Jose Roque.
Good stuff.
Good
Good
shit.
stuff.